So if you're a member of the board, please announce yourself.
Hello, this is Jorge Santiago, Vice President.
Hi, Jorge.
Hello, everyone.
I'm Greg Thomas, Board President.
This is Brooke Harrison, board member.
Board member.
Okay, well, we do have a quorum. I didn't hear Landry chime in.
Getting on. Can you hear me?
Oh, there you are, Landry.
Okay,
Hello.
sorry about that. I'm here.
Okay. All right, well, we have all of our board members here, so we do have a quorum. This meeting calls to order the regular meeting of the Boulder County Board of Health on Monday, August 9th at 5:32 p.m. Board members just introduced themselves. We have a lot of staff members. It looks like we have a lot of public and a lot of staff members. So Camille, I'm not sure we want to really go through introductions. Let's just get this thing started, okay? So we do have a quorum. This regular meeting of the Boulder County Board of Health has been called to order at the discretion of Public Health Executive Director Camille Rodriguez. Notice of this meeting was posted on the Board of Health's website as required by law and included the teleconference phone number and conference ID so members of the public could participate in this meeting. And we continue to meet remotely due to the ongoing COVID-19 pandemic and the need for social distancing. So with that, we will jump right into the agenda. And usually our first item is public comment on any items not scheduled as part of the agenda. Do we want to do, Camille, or do we want to do all of the public comment up front, or do we want to wait for the various parts of the agenda?
President Thomas, I think it's really at the pleasure of the board, and with so many public participants this evening, I would make a soft recommendation that we go ahead and listen to the comments.
Okay.
That would just be my recommendation.
Yep. How do we figure out who is giving public comment, Kate?
Hey, Greg. Yeah, we were thinking about that earlier. So I'm thinking what we can do, and you know, we're gonna have to figure this out because we've never had this many people in a Teams meeting before. I'm thinking we could maybe just start by going down phone numbers, and if persons, when we call out the phone number, if they can state their name and their address, Rita will track it. And then as we call your phone number, if you can just tell us whether you will be speaking or if you are, you know, granting your time to someone else, or if anyone's granting their time to you to speak. And so we'll just go through the list, and then, you know, we'll do a final call at the end to see if there are, you know, any phone numbers we may have missed. Does that sound like a plan?
Yeah, that sounds good to me.
Cool. Awesome. All right. Well, I'm happy to start. Unless you would like to go through the phone numbers, I'm happy to do it. We'll start with 203-216-3780. If you could just state your name and your address and whether you are speaking or giving your time to someone else. (203-216-3780). Final call.
Hi, is that me?
Hi, I'm not sure.
Hi,
Is that
thank
you?
you so much.
Perfect. Okay, great.
Teams assigned me a random number to call in from. I would like to speak, and I'm not sure when it'll be appropriate, but I am a parent that resides in Boulder County. I'm very concerned about the kids in school this fall not wearing masks and the spread of COVID among children. So I'm not sure when would be the appropriate time to register that concern, but I wanted to make it strongly known.
Yeah, let's do it right now. Are you going to be speaking for anybody else or just yourself?
Just myself tonight.
Okay, great. If you could just state your name and then your address, and you'll have 3 minutes to speak, and we will let you know when that time is up.
Okay, absolutely. Nicole Perlman, 5785 Old Stage Road, and that's Boulder 80302.
Great, you can go ahead.
Okay, thanks. I'll make it brief because I know there's a lot of folks on tonight. I'm just probably one of about 100 concerned parents that have joined tonight. The kids are about a week away from going back to school. We know that the incidence of COVID is rising across the country, even though it might not be quite as high in Boulder County as it is elsewhere. We do know that the children are still, at least elementary school children, are largely or completely unvaccinated if they're under age 12. We know that the Delta variant is extremely contagious. We know it has lasting effects in children, and the last thing we need is outbreaks and our kids getting sent home from school again. They've already lost a year of learning. They've already suffered enough. Parents have already missed work and been burdened trying to be educators, which they're not qualified to do. We know that the school district will closely follow whatever Boulder County Public Health decides to do. So I strongly, strongly, strongly encourage you to follow the CDC's guidance and issue a mask mandate again for the county. It's going to be absolutely essential to keeping our kids back in school and keeping them healthy and keeping this community healthy. Thank you.
Awesome, appreciate that. Going down my list, and if I'm calling bogus phone numbers, we'll make sure that we get everyone at the end. Anyone associated with 240-350-0464? I'm thinking maybe due to the area code that might be a fake number. Okay, moving on, 303-356-5928. 303-356-5928.
Kate,
Mhm.
this is Landry Fagan, board member. I'm wondering if you can unmute the numbers and if they can see if they're getting unmuted, if that's a way to identify them.
Oh, good thinking. Yeah, let me try that. Okay, so I will unmute.
This is Camille. You could also, if they're able to, have participants raise their hand, and that way we'll know that they're just, that they're here to speak.
Great
because
idea.
I bet there's
That's a great idea, Camille. Perfect. Okay, since it turns out, not all of these numbers are actually associated with person's individual phone numbers, if you could just raise your hand, that would be much quicker. Thank you, Camille and Landry. Okay, so we'll go ahead and start with Ben Bishop. You popped up to the top.
Hi, my name is Ben Bishop. My address is 1763 Montgomery Circle in Longmont. I'll be speaking for myself, please.
Great, thank you. You can go ahead, and I just want to remind the whole group that we are, timing for 3 minutes, and to help assist with your 3-minute tracking, there is a time ticker at the top for the recording of the teams to the extent that's helpful for anyone. But Mr. Bishop, you can go ahead.
Thank you. First, thank you to the board members. I understand your service is on a voluntary basis, so thank you. I understand you'll be caught in the middle of a lot of strong opinions tonight, so appreciate you putting up with that and listening. My opinion is that everyone who wants a vaccination can get one now. Kids aren't threatened by COVID. Anyone who wants to wear a mask can wear one. So please allow personal freedoms to be as free as they can possibly be, and let people choose their own method of protecting themselves. Thanks again for your service and for having this meeting tonight. That's all.
Perfect. Thank you so much. Alicia Heim.
Hi, yes. I'll put myself on camera right quick. Thank you. My name's Alicia Heim, and I live at 2927 11th Street in Boulder, 80304. I appreciate the opportunity to make comments this evening. I wanted to share my support of the proposed public health order that will require masks indoors for ages 2 and older in camps, schools, and childcare facilities. My 2 kids are ages 4 and 8. They are too young to be vaccinated against COVID. So no, not everyone who wants the COVID vaccine can get one yet. The kids under 12 cannot. I am anxious for them to have in-person school this fall, and I also want to keep them as safe as possible. Wearing masks is one of many mitigation strategies we can use to prevent COVID. Please help our community stay safe and require masks for camps, schools, and childcare facilities. Thank you.
Great, thank you so much. Tamara McCarty. I apologize, Tamara. We're having a really hard time hearing you.
Okay, I'll start up. My name is Tamara McCarty. I live at 2829 Blue Jay Way in Lafayette. I'm here to speak in support of the mask mandate for indoor locations. My family is all vaccinated. However, the vaccine is not 100% effective against the Delta variant. Right now, it's approximately 80%. And due to antibody degradation and mutation of the virus, it looks like that's losing effectiveness at approximately 5% every 1 to 2 months. So by the end of the school year, the efficacy of the vaccine as protection against the Delta variant may be below 50%, which is very concerning. We can wear a mask when we go out, but the greatest protection comes from those who are contagious wearing a mask. Unfortunately, I've seen a lot of people who are anti-mask or anti-COVID who are choosing not to wear masks, even in places where they're supposed to right now. I can't control their behavior. A governmental mandate can do so and require that they wear them. And that's the best protection for everybody else who is doing what we can to help control the pandemic and to keep everyone in our community safe. And I know that some anti-masker is going to come on and cite the bogus study saying that masks are dangerous for children. So I want to point it out that that study has been retracted and proven to have not been legitimate. But studies are showing that approximately 23% of people who have COVID, even asymptomatic or mildly symptomatic cases, have had to seek treatment from doctors for other problems for multiple months. So we know that there's at least a 23% long COVID problem. And the risk of anything from masks is probably zero, but certainly less than the risk of COVID itself. So please do reinstate a mask mandate for our county and for our schools. Thank you very much.
Great, thank you so much. Laura Witt.
Hi, I'm Laura Witt. My address is 3413 Larkspur Drive in Longmont. And I would like to speak on behalf, honestly, of my 11-year-old twins, and I have my daughter here with me. She'd like to speak as well, because we feel very strongly that for them to safely return to school, we need them masked. My children were both held back because they were born early and had some major delays. And going into COVID, they were already a little behind, but the fact is they still cannot legally get vaccinated yet. And so while I am, and their father is, and even their older siblings are, I feel like really the truly best protection for them is knowing that their teachers, their paraeducators, other adults in the building with them will be safely covered as much as possible, because we really don't know. I have had a friend whose child, my kid's age, got the Delta variant. And so I have some real concerns, and I don't want to see that. So I will let my daughter Katie say what she has to say as well.
I think that it would be safer for everyone if everyone wears masks.
Okay, thank you.
Awesome, thank you so much. Lucia Hera. Lucia? Okay, we'll come back.
I did.
Oh.
Yes, can you hear me now?
We can, thank you.
Okay, my address is 610 West Juniper Court in Louisville. And I want to, first of all, say not everyone who wants a vaccine can get one right now. That is absolutely not true. And I was noticing earlier today that New York Times headline reads a surge among children. In parts of the nation, the positivity rate in kids between the ages of 11 and 18, is 18%. And while Boulder is currently enjoying a transmission level below the national average, cases all around us are going up. And Delta is showing through preliminary data that it is both more severe and more contagious in kids. Now, it's not the time for us to drop mitigations against this virus. We need to double down on them and make sure that the surges that we're seeing across our nation don't impact us as heavily. And I believe that the best way to do that is to have a universal mask mandate for anyone who is medically able over the age of 2 in any public space, but most especially for schools. I recently delivered a petition to BVSD and I included Boulder County Public Health on that with over 700 signatures. People still sign every day, and we are asking for universal masking. When we were asked to decide on in-person versus virtual school back in February, Delta was not an issue, and many of us had hoped that kids could be vaccinated by now, but Delta and the lack of vaccines means that our kids are especially vulnerable. So I would hope that everyone in our community would mask up, but unfortunately that's not happening. I go to the grocery store, definitely not 80% of the people are masking. So that's what we need to achieve here is safety by layers of protection for these vulnerable kids who cannot get vaccinated right now. My daughter, who is in 10th grade at Centaurus, will be speaking at the BVSD meeting tomorrow night in favor of masking. Both of my kids have been masking this entire time. They have never had any negative health outcomes from that. In fact, they prefer it because they feel like they can feel less anxious about getting infected. So if they walk into a classroom and their classmates are not masked, that's going to lead to some mental health issues for them. We're also seeing that Delta means that even vaccinated people can spread. So masks are needed more now than ever. I would just like to suggest that we stop giving bandwidth to anti-scientific nonsense under the guise of personal freedom. The antis have allowed those of us who have masked and vaxxed to bear the burden of creating a bubble of safety that they currently enjoy. They leech off our sacrifices and now are demanding that their children be allowed to show up unvaccinated and unmasked in classrooms. And I would like to say that I take exception to that. I should not be asked to keep my child home because those individuals are refusing to take tiny steps. A mask is a tiny step to keep our community safe. So I am strongly in support of a mask mandate, and I will let someone else speak. And thank you for your time.
Great, thank you so much. Elizabeth Fashing?
Hi, can you hear me? Hi.
Yes, we can.
Hi, I'm Elizabeth Fashing. My address is 786 Sundance Lane in Erie, East Boulder County. And I'm also here to speak in strong support of the proposed mask mandate, especially in daycare centers and schools. I too have 2 children who are not eligible yet for the vaccination. You can hear one of them now. And even though my husband and I are vaccinated, we know that our children are still susceptible, especially with the Delta variant rising and now the predominant strain in the United States. And there's been an alarming trend of rise of cases in pediatric patients requiring hospitalization. So we need to do everything in our power to keep our children safe as they return to school. And that includes universal masking for all students, because we now know that even vaccinated persons can potentially spread the Delta variant. And almost all of the children that go to my son's school, it goes through 8th grade. So very, very few of them are eligible for vaccination right now. When it comes to public health, we need to rely on science and data. And right now, the data is telling us that we need to continue mitigation efforts. When I go to the store, I am usually now one of the only people that wears a mask, even though I am vaccinated. So mandates are what we need to ensure that those who maybe don't want to still are required to do what is right. So please base decisions for public health on science and data and not politics, and please put the mask mandate in place. Thank you.
Thank you. Jessica Wicks?
Hi, can you hear me?
Yes, we can.
Okay, thank you for your time. So yes, Jessica Wicks, and I live at 96 Laner Drive in Erie. I have 3 kids that attend St. Vrain Valley schools. And I would like to also speak in regard to the mask mandate and would love to see the mask mandate actually made optional. My youngest will be a kindergartner this next year. He went to preschool in a St. Vrain Valley school last year and wore a mask. And in his 2.5 hours of preschool every day, he came home with soaking wet masks. And he's a little boy. He's a 5-year-old little boy. It was 4, now 5. And I don't feel like having something like that on his face is the best option for him. He's learning language, and so much about what he learns in kindergarten is because of being able to see teachers' faces and lips and the lips of his classmates. And I think that it's really important. I obviously want my children to be healthy. I think that the ventilation systems that have been put in place and hand washing, sanitizing, social distancing, I think are all very effective. And I know that many people will wear a mask either way. And so I would like to advocate that masks would be considered optional for the well-being, especially of my kindergarten child. Thank you.
Thank you. Amanda Dean,
Hi there, can you hear me?
we can.
All right. Again, my name's Amanda Dean. I am at 1320 Carnation Circle in Longmont, 80503, and I am a parent in favor of masks. According to an email from Johnny Terrell, the Assistant Superintendent of Student Services, dated July 6th, said that masks would no longer be required in our schools or buildings regardless of vaccination status. That mask would strongly be encouraged for anyone who has not been vaccinated. I feel like this is highly inappropriate given that there isn't a vaccine for children under the age of 12. The fact that we're all meeting virtually tells me there is still a great need to exercise caution around COVID-19, as most of us are adults and probably vaccinated. To encourage children to wear a mask if they're unvaccinated is a huge ask. Peer pressure, bullying, and a desire to fit in are very common among kids. Adding this additional pressure will have an impact socially while increasing the potential to spread COVID-19. Adults are struggling with the concept of wearing a mask if they're unvaccinated. Asking children to do this, we will see children singled out or divided by making masks optional. There's a great deal of data from the CDC, American Academy of Pediatrics, and other health agencies about the use of masks to prevent COVID-19. There's also emerging information about the dangers of long COVID for children, including cases with mild symptoms. While most children who get COVID-19 will live, there are long-term health outcomes that we need to consider, especially given a large percent of the population is unable to get vaccinated due to age or other issues, including the need for parental consent. So we may have middle school and high schoolers who want to be vaccinated, but their parents are not allowing them to. If the goal is to safely get as many kids back to in-person learning as possible, then masks need to be required for both the physical and mental health standpoints. Parents, such as myself, who are concerned about the COVID-19 spread, would be much more likely to return to in-person learning if masks were required. I understand many families are not in favor of masks for various reasons. Those who do not wish to wear a mask have the option to enroll in the online learning programs to meet their needs while keeping students safe. So there is a safe option available to them. I call upon the board to continue to make guidelines that will provide the greatest good for the most people. You guys have done a fantastic job so far, and I would like to keep that going. Right now, that means requiring masks for our students, especially those that cannot be vaccinated and do not have the option to learn at home. Left without guidelines from Boulder County Public Health, I fear that the St. Vrain Valley School District will jeopardize the health of the students by continuing to make masks optional, regardless of vaccination status. Thank you all for your time. I really appreciate it.
Thank you. Grant Orbis. Grant Orbis. Okay, we can always come back to you, Grant. Lindsay Diamond.
Hi, can you hear me?
I can, thank you.
Thank you. My name is Lindsay Diamond. My address is 7303 North 115th Street, Longmont, 80504. I just want to thank the board for the opportunity to comment and share my strong support for the public health order this evening for requiring facial coverings for 2-year-olds and above in indoor settings. I think it's our collective duty to protect our most vulnerable community members, of which many of them are our students, our children, and certainly with the rise in Delta and future variants in pediatric cases and hospitalizations. This is of particular concern to many of the parents in this county. I do want to applaud the county and all of the wonderful efforts that have been made to improve the HVAC systems and sanitizing opportunities. But as we know, the science tells us we need a multi-layered approach to protect students, educators, and staff. And the masks are an absolutely vital part of that multi-layered approach. And so I know you have many people to hear from, so I just want to keep it short and go with brevity, but I am in strong support of this public health order, and I hope that this makes it possible for many of us to send our children back to school who were unable to for the last year due to the situation and the ongoing situation. So thank you.
Thank you. Christine Nelson.
Can you hear me?
Yes, we can.
Great. Christine Nelson, I live actually in Westminster, but I called this morning, and because my daughter attends Boulder Valley School District, they told her that she would be allowed to speak. So are you ready?
Yes, we are.
Thank you, Kennedy.
Hello, I'm a junior in Boulder Valley School District. My freshman year ended with online learning. My sophomore year was spent almost entirely behind a computer screen, except for the last 8 weeks of part-time school where my friends, classmates, teachers, and I were hidden behind masks. Because of the rules BVSD had in place, my classmates and I missed out on so many important milestones. Because of quarantine rules, my teammates and I missed out on a chance to play in the state volleyball tournament. Because of mask rules, I never saw my teacher's face when in person or my coach's face on the sidelines. My brother will be a freshman. High school is intimidating enough. Can you imagine having to do it with everyone hidden behind masks? I got vaccinated in April. I did this for many reasons, but especially so school could be normal for me. I have spent the entire summer maskless, in gyms playing volleyball, in a weight room working out, at the movies and the mall, at restaurants and coffee shops, and traveling to numerous college campuses across the South. I have been healthy the entire summer. My best friend in Adams 12, literally 2 miles from my high school, gets to be in school and in the gym mask-free. My numerous other friends in Jeffco and Adams 12 can be mask-free too. My aunt, a teacher in Highlands Ranch, gets to be mask-free with all of her students. You know that schools are not where COVID is spreading. Look at your data and vaccination rates. High school students and teachers have done their part. Unless you make all Boulder businesses require masks indoors, you cannot make schools require masks indoors. If private school students in Boulder can be mask-free, then I should be able to too. Masking must be my choice and my parents' choice. We students need the option of normalcy for our academics, our mental health, and our daily social emotional experiences. Thank you.
Thank you. Brittany Jones.
46 Horizon Avenue in Erie, Colorado. Thank you all for the time and the ability to speak. I'll make it quick so that we can get on to the other parents as well. I am speaking on behalf of my children, Merrick, age 8, Sage, age 4, and my right as a parent to make decisions for my family. As you and the board converse about how we can best approach the masking requirements in school, I implore you to allow parents to make the decision that is best for their children and not violate that parent's right to choose. There are lots of reasons for and against masking in schools, and sadly, there is no right or wrong answer. You can hear that from all the different parents speaking tonight. If we allow parents to make the choice based on their family's risk level, vaccinated, pre-existing conditions, immunocompromised, etc., we are putting parents back in charge. And honestly, you will likely have more members of the community support you by letting them make the choice as to what's right for their children. While you will have parents that are unhappy, I truly do believe the majority of the population will be satisfied with the decision that you make. Again, if you want to mask your child in school, absolutely. If you don't, absolutely. But leave it up to the parents to make that choice. One big thing to note is that we have not actually really proven if masks work or not. The studies are out there, but there's nothing that has been independently proven that they work in this spreading COVID within schools. Thank you again. I beg you to let parents make that choice for their children.
Thank you. Cole and Elizabeth Strain.
Oh. I'm sorry, I'm new to Microsoft Teams. Can everyone see and hear me?
We can hear you. We can't see you.
Okay. How about
there we go.
Wonderful. All right. Thank you all so much for hearing from us all today. There's a lot to hear, so thank you all for going through this on our behalf. My wife and I are parents in favor of masks. We are parents of elementary age students in St. Vrain Valley School District, and we are in favor of the mask mandate for K through 12 students. There's a large population of students who are just, these students are unable to be vaccinated, and the presence of masks amongst all ensures that all students are able to remain safe. We know that the variant is highly contagious. We know that masks are an effective way to prevent this. So much of the success we saw from school district numbers last year was an account of this layered approach. We are too soon to be removing layers. Looking at the bouldercounty.org numbers, the rates of children with COVID from 0 to 9 have skyrocketed in the last few weeks. Fewer than 20 per 100,000 in early July to over 120 cases per day now. We know that masking works. We know that the CDC guideline is recommending masking, and we know that masks work when everyone has them. So thank you very much, and thanks for representing us in this very difficult decision.
Thank you. Beth, I'm not going to attempt your last name unless I have to.
Hi there. I think you might be speaking to me, Beth Waskowitz.
Perfect. Thank you.
There you go. Hello there. I want to thank the board for allowing me to speak today. My name is Beth Waskowitz. I'm at 1807 Quest Drive in Erie, and I have a 5th grade son, or a son heading into 5th grade here. I'd start with sort of the question, have you ever run 26 miles and then claimed that you finished a marathon? Because 26 miles is really a long way, and at that point, we're all tired and ready to be done. But we're not done. The final stretch of this race still remains, and that's where we find ourselves now with this pandemic. I'm here to speak in strong support of masking in schools because it's this very population that has not had a vaccine made available to them at this point. Schools this fall are expected to be 100% open, which for many schools means there's an inability to maintain at least 3 feet distancing. And mostly it was 6 feet distancing for all of us this whole last year in an indoor space. These are the very guidelines that we asked the entire adult population to abide by for last year until vaccines were made available to them. So I guess, why would we suggest that this segment of our population, these school-aged children, not be afforded that same protection? Last year, we had our son attend BU. In March of this year, I received a form asking me to declare if our son would continue at BU or return to his neighborhood school for this coming school year. Because I saw vaccines rolling out for adults, I knew vaccines for children would follow. I was seeing masking at schools, that whole layered approach. They were working on a minimum of 3 feet distancing, and there was a relatively low rate of transmission because of those precautions. And because of that, I chose to have my son return to in-person learning for this fall. But I'm saddened now to see that these vaccines for this demographic, the 5 to 11s, likely won't be made available until midwinter. And if we do the math for that, that means full coverage, vaccine number 1, vaccine number 2, full coverage won't be achieved for these kids until early March at best. So this means we've got almost a full school year that we're going to be going through with these children unvaccinated. And I want our son and our family, I want our community to feel safe. And what I feel is concern over possible dropping of masking policies, especially in light of this new, more infectious variant that none of us knew about 5 months ago. The Delta variant now accounts for 75% of all COVID cases in Colorado. And this variant is more transmissible and really underscores the importance of vaccinations, but also of continued masking of the whole population of all of those children in that school building. And there's doctors down at the University of Colorado School of Medicine that are saying, kids under 12, they can't get vaccinated. There's no question they're getting sick. They're ending up in the hospital, and they're seeing it in their numbers. And we're seeing it here in the Boulder County numbers as well. And the speaker just before me pointed out that rise in rates for that 0 to 9 group of now almost 120 to 140
Ma'am, your
per 100,000.
time is
and so
up.
I'm
Thank
really,
you.
I'm really
your time
concerned
is
about
up.
this, and I want to stress my support for the masking. Thank you so much for your hard work. I appreciate it.
Thank you. Katie Farnan?
Hi, my name is Katie Farnan. I am at 4728 Berkshire Court, Boulder, Colorado, 80301. I want to thank the board for this opportunity to comment. My first grader goes to Crestview. My 5-year-old will enter kindergarten this August. I will feel safe sending my children outside of my home if there is a mask mandate for all workers in the school and all children attending who cannot get the vaccination. Everybody there. I'm seeing how this virus has evolved and mutated and how it's getting closer and closer to impacting children's safety. My children are not subject to non-scientific experts deciding what is and isn't safe. My children do not have the protection of a vaccine to mitigate any symptoms from this disease that has sickened and killed millions of people across the country. Folks who feel that masking isn't for them can choose online options, which is what we all had to do last year for a period of time. Not only can children have long-lasting health conditions from the virus, they can incubate variants that will cause us to drag this pandemic out far longer with more infectious cases and severe reactions. The fact that we are dealing with a serious variant of this virus is because the virus has been able to replicate in unvaccinated bodies. This is preventable. And if we're going to come together in school in person, we have to take these measures. And again, my children are not subject to parent choice that involves their health being impacted by the self-centered decisions of their peers' caregivers. Science matters, children's lives matter, protecting others matters, and the fact that people want to opt out of masking when it is unrelated to any real medical issues, to me, is a kind of behavior I don't want to teach my kids. We protect each other. I wear this mask for other people. My children wear their masks to protect themselves and their peers. Their peers and their teachers and school staff can wear them for me and my kids. I'm in strong support of total masking this fall. Thank you.
Thank you. Grant Orvis? And we can't hear you if you are trying. Okay, great. There you are. We still can't hear you. Doesn't look like you're muted. Oh. No. Yep, if you want to put it in the chat, that's great. And while Mr. Orvis is typing his comments, I don't see any other hands raised. If you would like to speak, please raise your hand, or if you can't find the hand function, just drop your name in the chat and we'll make sure to call you. But we are nearing the end of the public comments.
Yes, what about people on the phone list?
Hello, I'm on the phone. So
okay, people on the phone. Okay, yeah, we'll get to you guys. 1 second.
Okay, will you be able to see our phone numbers or?
We have a lot of phone numbers. So we might have to just have you guys, call out your names one at a time.
Okay, and my battery, I'm sort of, it's going down quickly. Would I be able to speak fairly soon?
Sure. Yeah, we can go ahead with you next. Just once Mr. Orvis has had a chance to type his response.
Okay.
Perfect. Thank you, Mr. Orvis. Okay, ma'am, you can go ahead. Just please state your name and your address.
Okay, Gretchen McLaughlin, 4607 Southampton Circle, Boulder, 80301. I'm here to speak on masks. So masks are greatly harming our children. Masks cause anxiety, panic attacks, headaches, and more. Dr. Jim Meehan, a preventive medicine specialist who's performed more than 10,000 surgical procedures, is also a former editor of the Medical Journal of Ocular Immunology and Inflammation and has conducted an evidence-based scientific analysis of masks, which show that not only healthy people should not be wearing masks, but they could be harmed as a result.
Yeah.
Universal masking of children is experimental and the safety has not been proven. Dr. Meehan states that the official change in guidelines from first telling people to avoid mask wearing to later mandating it in many places wasn't the result of new science, but rather was the result of lobbying. Dr. Larry Pavlesky, a New York pediatrician, warned that masks could be harming children's brain development by promoting fear, stress, panic, and anxiety. It keeps children in the fight or flight response driven by the brain. This greatly influences the capacity of development and higher functions of the brain. Here's just a list of some health problems seen in children: anxiety, facial rashes, oral ulcers, panic attacks.
Ma'am, are you still there?
She said her phone was going dead. I suspect it did.
Okay, thank you. We'll move on down our list. We do have
She
a few
still
more
has
hands.
battery. She still has battery.
Oh,
She's right
okay.
here.
Okay.
Here, come from here.
Okay, hello, can you hear me?
We can. We lost you for a second.
Okay, so there's a lot of interference. All right, here's a list of the health problems seen in children: anxiety, facial rashes, oral ulcers, panic attacks, infections, cavities, struggling to breathe, dental problems, throat abscesses. Here are some of the ways masks can harm. Medical masks adversely affect respiratory physiology and function. Medical masks raise carbon dioxide levels in the blood. Medical masks trap exhaled virus in the mouth mask, increasing viral infections load and increasing disease severity. Masks also violate the OSHA laws. You never put people in personal protective equipment without first giving them a medical exam to see if they can even tolerate wearing PPE. Wearing a face mask gives a false sense of security. Untrained and inappropriate management of face masks is common. Masks collect and colonize viruses, bacteria, and mold. Face masks are dangerous and contraindicated for a large number of people with pre-existing medical conditions and disabilities. Medical masks lower oxygen levels in the blood. Masks can increase COVID-19 severity. Cloth masks may increase the risk of contracting COVID-19 and other respiratory infections. Masks compromise communications. Masks worn imperfectly are dangerous. Wearing a face mask makes the exhaled air go into the eyes and can impair vision, which sometimes can lead to falls. Face masks and stay-at-home orders prevent the development of herd immunity. Cloth masks cause lung infections due to inhaled fibers. Forcing a child to wear a self-suffocating device covering their nose and mouth, which restricts breathing, is completely illegal and criminal. It is also child abuse. Additionally, the only mask authorized by the FDA pursuant to emergency use authorization is the N95 NEOSH mask. All other masks, fabric and paper, are completely unlawful, and the Board of Health, as well as the state,
Ma'am, your
has
time is up. Thank you.
Zero lawful authority to mandate them.
Thank you, ma'am.
And do you mind if I continue after her? I donated my phone while she did that.
Sure. Yeah, can you just
Okay.
please state your name and your address?
Yes, my name is Warren Hultquist. I live at 1820 Mapleton Avenue in Boulder. And I'd like to thank the board for giving us time to weigh in here. I've heard a lot of parents raise this issue of the JAMA pediatric study that they're saying was, quote, disproven, unquote. There was no disproof, and basically what happened is there was political pressure to withdraw it. There was no scientific rebuttal to it, and essentially it's common sense. If you put something over your mouth, you're going to be rebreathing more of your CO2 and getting less oxygen uptake. This is bad. It does cause brain damage. It causes hypercapnia. And yeah, people can kind of push through it. They may not associate the fact that they're lightheaded or have a headache or just subtle changes. And, you know, kids by and large are pretty resilient, but we don't have tests on this. And we do know that JAMA study raised some serious concerns. We're not talking about a little bit here. We're talking about in 3 minutes, you had children breathing levels of CO2 that were way off the charts, way above anything that's allowable in even an open room. And this is unconscionable. Basically, basically at this point, you folks have all that science and you know it from common sense. You could also just get your own pulse oximeters. You could get your own CO2 meters and measure this. Do it with some children. Do a science experiment, and you'll see that it does it. I've worked in industrial settings where we had to use respirators and things like this, and we would monitor these things, and it was very clear and obvious. These masks also, by the admission of Fauci himself in his own emails, are very clear, saying, you know what, this is symbolic. This is a symbolic gesture. And we see a lot of other people that signal by wearing the mask in their photo opportunity, but as a politician, they take them off. So we know we're being gamed here. The thing I would like to ask the board is, if the board members are in any way threatened or paid indirectly or indirectly, you got to come clean at this point. You have to be a whistleblower. What we're seeing here is just absolutely amazing and stunning in terms of what's being coerced. I've lived in Boulder, fourth generation native here, and I grew up just blocks from here, from the building you were supposed to be at today. And I can hardly believe what you folks are doing. I can't believe this is even on the table for being considered. If people are still afraid and fearful of something, a variant that as variants tend to do, they get less deadly. And these variants that get less deadly have higher transmission rates, yes, but that's the fear-mongering word that's being used. And that higher transmission rate is something that, in a way, you should see, okay, it's less deadly and it's going to move through us like any seasonal flu or cold is going to do. So, and you can look at the UK, you can look at isolated cohorts like Gibraltar, or look at an isolated cohort like I think it was an aircraft carrier in the British Navy.
Your time is up, sir. Thank you. Thank you,
okay,
sir.
well, thank you, folks.
Thank you. We have a few more hands raised. Lexi, you have your hand raised.
Can you hear me?
We can. Thank you. If you could just state your name and your address, please.
Yes, ma'am. My name's Lexi Olson. I am at 440 Capitol Avenue, Berthoud, Colorado. I have 3 children who attend a elective school in Longmont in St. Vrain. And I started homeschooling before it was the popular thing to do. However, I really wanted my kids the opportunity to make friends in another school environment. And I was not able to send my kids anywhere that required a mask. We even have a climbing membership and we are not able to use it because there is masks that are required, because my kids have panic attacks. They get anxious. I have one kid that is, he has sensory processing disorder, and that's one of the reasons why I am homeschooling him and only sending him 1 day a week to this elective school. And if you take this option away from me, I am going to have to take that away from them. And I feel that like they feel they are being punished, that they don't have a say in their own medical autonomy. And we as a family believe that is wrong. And I very much urge you to look at the other side and take it seriously, and please make masks optional. I have no problem if one person wants to wear a mask. I don't care. I'm not going to say anything, but just make it so that it's optional for us people who want our children to have their own feelings of power over this, because this is really, 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 really hard. Thank you for your time. Have a good night.
Thank you. Justin Verant.
Yeah, I'm here. I'm just going to turn on my video.
Perfect.
So my name is Justin Verant. I live at 3035 O'Neill Parkway in Boulder, apartment S11. Yeah, I mean, I feel opposed to this mask mandate, and I favor health choice and health freedom, and I favor science and open-mindedness. Gretchen talked a lot about like the difficulties involved in mask wearing, the problems associated with it, the health problems. We depend on oxygen to live. And if you're having to wear a mask 8 hours a day, it's going to affect your ability to function. I worked in a medical environment up until July, working with elders in a dementia care facility. And I wore a mask 8 hours a day, and I developed symptoms of asthma. And initially I wondered if it was like COVID symptoms, but once I was able to not wear the mask, I learned that it was from wearing the mask. So I do think people can have serious health problems, even resembling asthma, from wearing masks for 8 hours a day. I also think there are alternative treatments for COVID that have been suppressed, and even like research about those treatments has been suppressed online. This is really concerning. Some of these include hydroxychloroquine, ivermectin, vitamin D, vitamin C, and zinc. I also feel like the lethality of COVID has been exaggerated. For example, I could die in a motorcycle accident and have tested positive for COVID like 2 weeks earlier, but have no symptoms of COVID. And I would be listed as a COVID death, according to the CDC. I would be one of the 450,000 people who've died of COVID. So I just feel like there's a lot of fraud in the statistics related to this this issue, and it's very concerning. I also think I've seen more people die from the vaccine or be injured by the vaccine than from COVID-19. I had COVID-19, and it was like the flu. It wasn't worth shutting down civilization over. On the other hand, I saw people vaccinated in this elder care facility. 60 people were vaccinated, about 5 died.
Your
3
time is
days
up,
after
sir.
being
Thank you.
vaccinated.
Thank you, sir. Wendy, your hand is up. Wendy? Okay, we can come back to you. Riley Mancuso?
Hi, my name's Riley Mancuso. I live in Lafayette. I work in education and childcare, and I live with a food service worker. And I want to speak out in favor of not only a mask mandate for schools and childcare facilities and other congregate living and education facilities in Boulder County, but also for all indoor public locations, including stores and restaurants. In fact, ideally, I would like to see indoor dining once again restricted, but I think that really what we have seen consistently for the past year and a half is that every time any restrictions are relaxed, cases rise. And as restrictions are implemented, cases fall. And before they fall to 0, we always loosen restrictions. And unfortunately, the county is limited in what they can do, because if our federal and state governments had paid everybody to stay home for 4 to 6 weeks in April of 2020, we could have literally eliminated the virus. And because they won't do that, then we need to take what steps we can on a county level and do whatever we can to reduce the risk of transmission by whatever % we can. I think that as we have had this public health mandate in place for most of the past year, I think that the board is aware that it worked and that it helped reduce cases. And so I think we need to, people have said that we need to make it the last mile. I mean, we've been frankly running backwards for the past couple of months as we've rushed to eliminate public health transmission reduction measures, despite insufficient vaccine rates in the population. So yeah, very strongly in favor of a mask mandate. So please make that call today. Thank you. Good night.
Thank you. Shara Davis. Shara Davis. Okay, we can come back to, oh, perfect. Hello. Can you please state, perfect. Can you state your name and your address, please?
Sorry.
You're okay.
Hi, I'm Shara Davis. I'm a resident of Longmont. I live at 312 Widgeon Lane in Longmont. I have 2 children in St. Vrain, and our family did experience COVID, and as a result, we are very much in favor of a mask mandate. We have found that our young children who were 4 when this all started have actually done pretty well with masking and are more than happy to wear masks if it means that they get to go to school and see friends. I think a lot of other people in public health are have much better experience to describe the research for masking, so I won't do that, but I will just give my voice as a parent in the community who was very afraid to lose my husband, and we were very fortunate that he recovered after several months of symptoms. And I hope that those of you who have not experienced that never have to, and I will continue to wear a mask so that you don't. And I'll end my comment there. Thank you.
Thank you. Elizabeth, you have your hand raised.
Hi, I'm Elizabeth Dunford. I'm at 909 Little Leaf Court in Longmont. I have a 5-year-old and a 3-year-old. And I want to say thank you so much to the board for hosting these and making them open to everybody. And also thank you to all the employees at Boulder County Public Health, because I know it's been a really hard year and a half. I also appreciate how much you do to disseminate science-based information, because and I just know it must be difficult to hear sometimes what people think. I would really encourage a mask mandate for schools. It was actually really impressive last year when my daughter was in pre-K to see how well kids did wearing the mask. And, you know, knock on wood, how we had no COVID transmissions in our classroom. So again, thanks so much to the board and the employees, and I hope this focus on science will continue and that you will require masks for the schools. Thanks so much.
Thank you. Mark Milliman. Mark Milliman. Okay, we can come back to you. Shay O.
Me?
We can.
Awesome. I plugged in a different headset, so I wanted to make sure. I just wanted to say that me and my husband have 2 kids that are going to be going to school this fall in St. Vrain, and we are strongly in favor of mask wearing for everyone, just to keep everybody safe. Everything I've seen says that masks work best when everyone is wearing them, because we don't know with COVID who is sick and who is not. And we just want to be safe, and we want our kids to go to school, and we don't want to have to try to find a way to homeschool and juggle everything, because our teachers are amazing and we would rather they be in school with those awesome trained teachers and their friends. Thank you.
Thank you. Jane Meager.
Hello?
Hello.
Can you hear me?
We can hear you. We can't see you, but we can hear you.
Okay, yeah, so I too appreciate the opportunity to speak and that you've opened this up to the community. I wanted to make you aware that in Florida last year, they had an open school policy in person for the entire year. They left it up to the individual districts as to whether masking was required or whether it wasn't. And they found that there was no distinguishable or statistically important difference between the schools that were masked and the schools that didn't require masking, and that there was no additional incidence of coronavirus being spread among the students in the situation where there were no masks required. So I think that that's a really good indicator that there's a lot of discussion about whether masks work or not. But I think in the youth environment, I really, really think that it's so bad for them, and it's offset by the need for them to be able to express themselves, to be able to learn, to be able to distinguish from their sounds and all. So I would like you to not require masks next year. Thank you.
Thank you. And I will just remind speakers to please just state your name and address when you're speaking. Joe Messling. You're muted.
Hello.
Perfect.
I was muted. Hey, thank you very much. I've really appreciated our partnership with Boulder County Health. You guys have done a lot of great work this year. I'm Joe Messling. I live at 2100 Breckenridge Drive in Berthoud, Colorado. I'm the director of Twin Peaks Charter Academy. One voice, but I think an important voice, because last year, my elementary students had 50 days of in-person instruction. My secondary students had 100 days of in-person instruction. And I know you have a hard decision, but here's what I'm going to ask tomorrow when I meet with our partners in our Zoom meeting with small and charter schools. I think there's 4 questions you have to answer before you make your decision. What are you basing the metrics on this decision? You go to the CDHP website, Boulder County is 80% vaccinated, an extremely low hospitalization rate. That doesn't make sense to me at all. Second, what metrics will alter the decision? Because I think we've been very confused about moving the goalposts. So if you make this decision tonight, I hope we hear what will alter these goalposts getting moved all the time. Then, what are the requirements for personal exemptions? Religious, personal, medical, I think they need to be clear. I think they need to be realistic. I think we all need to know what are the requirements for exemptions. And finally, I think the most important question for all of us, do you really expect me as a leader of a school and my leadership team to deny access to children in a public school with their needs, with their requirements, and with their accommodations if parents choose not to mask their children? We are a public school. You have a lot to deal with, and I know you have a lot of questions, but I have questions for you, and so will my community. And when we meet tomorrow with Taylor, I love Taylor. She's done an awesome job, great partnership, but you have to answer those questions in writing. Thank you very much.
Thank you. Mark Milliman, are you here now?
Yes, I am. Can you hear me?
We can. If you could just state your name and your address before you speak, please.
Yes, my name is Mark Milliman. Sorry. I'm at 4080 Greens Place in Longmont, Colorado. I'm in the St. Vrain Valley School District. And, previously I've presented facts and worked with you guys since the beginning of this, and lately presented some more facts through a written letter to you guys. But, I think this thing has gone beyond facts into this case, because, we know that in Colorado, out of 5.8 million people, that slightly over 1,000 kids have been hospitalized with this virus. 99% are treated as outpatients. We know this virus affects children a lot less than it impacts adults, and that children do not transmit this very easily to adults. Today, children have a chance of dying in this state of 78 other causes more than COVID. Okay, this is a risk decision we have to make. We know that the IFR is now less than the flu, and for a long time, the coefficient of transmission, or the R0, was less than 1, and now it's popped over 1 slightly. All the MPIs that were done last year, there's no correlation, statistical correlation, that shows that they were effective. We should not be repeating the same things that we did previously. Masks have not worked up until April 4th of 2020, when the CDC spontaneously changed their minds and said masks do work for viruses. That goes as far back as the Spanish flu, when they learned that masks didn't work then. Studies up to then, including recent ones done in Vietnam, South Korea, and Hong Kong, show that they don't work. Our own data in the Front Range looking at mask mandates in counties with and without the mandates do not show any improvement in transmission. And as Joe said, transmission is not the only parameter to look at here with this virus. So my question is, what is Boulder County Public Health's goal here? Is this zero COVID? Because we will never reach zero COVID. We need to learn to live with this and other viruses effectively. We do know that these new variants are less lethal than previous. What we are ignoring is the mental health crisis that was created over this. By refusing to let our kids associate with each other, by taking away their education. You have the data. I've seen the data from MHP. We know the number of excess suicides last year surpassed the number of children that died of COVID in the state altogether. Are we willing to repeat that again? I have specifically a child that was at high risk during that period of time.
Your time is up. Thank you.
So
Thank
I
you.
say I'm against this.
Thank you. Shelley, you have your hand raised.
Hi, yes, my name is Shelley Knuth. I'm at 1138 West Enclave Circle in Louisville. And I just want to say I support a mask component for schools. I think it's something that makes a lot of sense given what's coming out about what we know about how effective it's been thus far. The science is there for it. And I also think it's a way to keep our kids in school. The physical price of the pandemic plus the mental price has been hard for our kids to pay, and keeping the kids in masks, I think, keeps the kids in schools. And so I would support a mask component for fall. Thank you.
Okay. So now we are back to people on the phone that would like to speak. We'll just try going one at a time. If you're on the phone and you would like to speak, please speak up.
I'd like to speak.
Okay, you can go ahead. Can you please state your name and your address?
Sure. My name is Gene Slocum. I'm at 2001 Evergreen Avenue in Boulder. Thanks for taking the time to listen to me. I'm a medical doctor, and since the beginning of this has happened, I've been doing a lot of research because what the CDC was saying from the get-go didn't make a lot of sense. In fact, anything that I'd learned in epidemiology and infectious disease in medical school didn't seem to apply to what they were saying. This included wearing masks for viral infection. There's never been a case where masks work for viral infections. This has been proven over and over again throughout the years. There has not been a study since this has come out that proves that masks work. I will say again, there has not been a study that has been done that proves that masks prevent the spread of coronavirus. You can look at the various states and how they either locked them down and did mask mandates versus the ones that didn't, and there was no significant difference. In fact, some of the states that had the more draconian measures, like California, had worse outcomes than states like Florida, which did not. That gives you all the answers right there. There's not a study, first of all, that shows that masks work. It may make people feel better, but it doesn't make it right that they work. They don't. And also, psychologically, think about what you're teaching the children. People are dirty. Every child that sees another person or another child wearing a mask, oh, that person's dirty, I need to stay away from them. And as the previous person mentioned, the suicide rates have gone way up, especially in teens, since the pandemic started. I really appreciate your time. I think you need to look at evidence-based medicine. That's what we have to do as medical providers. And we can't get things authorized unless it is proven to work. But for some reason, masks have not been proven to work, yet people still think to seem that they should be implemented, and it's the wrong thing to do. People should be able to make their own choices. Thank you.
Thank you. Anyone else on the phone that would like to speak? Second call. Anyone else on the phone that hasn't spoken that would like to? Okay, and I'll give a
Hello.
Oh, perfect. Yeah, we can hear you. Can you please state your name and address? And I heard a second person too. We'll get to you as well. The first person that chimed in asking if we could hear you, could you please state your name and address?
Hi, my name is Andrea. I'm at 2800 Talmia, 80301. And I would just like to say that I am just really curious and have lots of questions that I would love for Boulder County Public Health to distribute to all of us so that we can make accurate and informed decisions for ourselves. First of all, I would love to have Boulder County Public Health be able to display the information either on the website or around town, which actually demonstrates asymptomatic shedding or transmission, and actually having those numbers, actual studies that verify what that transmission rate is and what our risks truly are. Because I haven't seen any of that information out in the studies that have been done, like the 15,000 people study that was done in China has pretty much been neglected, saying that there is absolutely no asymptomatic transmission, which would basically mean that masks would be moot. If there is no real transmission from anyone who does not have symptoms, then we really shouldn't have to worry about this. Second of all, I would really love to also have some transparency from the government and let us know that if you do please receive any sort of funding, either from the state or federal government, when you do implement any sort of mask mandate. Are you receiving anything that is going to financially give you incentive to do this, as opposed to just basing it on true public health? I do have other lovely questions. I know I'm probably close to time. I do appreciate you guys listening to all of us and taking the time for all of this. It's really great that we can come together and have a critical thinking and open debate and conversation about this. Thank you so much.
Thank you. And I did hear another person start to speak from the phone. If you're still here, can you please state your name and address?
Can you hear me?
We can.
Hello? Oh, okay.
Yes.
Hi. Sorry about that. I think I was the first one in the beginning and I was trying to talk, but you couldn't hear me.
Ah, cool.
So I've been
Okay,
trying
great.
to get on. I think I was muted. Anne Marie McDonald, 2045 Boston Drive, Boulder. I have a son in the Boulder Valley School District, and I am definitely pro medical freedom and choice. I think children are not at high risk for this. I feel like the pandemic, we're not currently in the state of an emergency, and that masks do more harm than good. I think a lot of people touched on it with lack of facial recognition cues, social cues, anxiety, fear. You know, if we don't wear the mask, we have to wear the mask. And I think I heard a lot of fear in the parents earlier with younger children, which I understand, not faulting them for being fearful, and they do want their kids to be in school. And that's why they're asking for that mask mandate. But imagine you can go to school and there's no mandate and you can choose to do what you want. And then I heard, well, then that's going to single out my kids. But it would single out kids on the other end if it's masks for vaccination, then there's that whole other issue. And I think the data, like a lot of these doctors and, you know, well-spoken people on the call have said, you know, it's highly treatable now, COVID. I mean, the death rate was so high because the response, you know, no one knew, running around, trying to learn from the Italians, trying to learn from the other countries that went through this. And largely, you know, there was goofs and people were put on ventilators because their oxygenation was so low, yet they're standing and walking and talking. The doctors are like, their oxygenation, this is protocol 60, you got to go on a ventilator. And so I think there were a lot of unnecessary deaths and very tragic. And now they know more. All these frontline doctors who are treating the patients and they're getting well and saying early treatment, don't wait till you can't breathe and are going to the hospital. And so I think there is a lot of good science and data. And I heard those earlier parents talking about data and follow the science and we have to protect others. Well, that's, you know, a little bit of that fear coming out because I think the actual data, you know, doesn't support this level of, you know, mask mandates and doing this. And Dr. Anthony Fauci himself on March 26th, early on, and the New England Journal of Medicine said masks do not work. So suddenly the politicized, you know, environment, and then it's like, well, we still should wear them because it makes people feel better. But he did not retract that in the New England Journal of Medicine. So I think from a virology standpoint, and now let the immunologists and virologists speak to that. But I think that there's serious concerns about people throwing around science and data in our children and protect, but it's like the actual data is not supporting that. Again, I understand the parents' concern. I, as a parent, want medical freedom, medical choice, and don't want, my child to feel like, oh my God, I have to wear a mask. I don't want to wear a mask. It's, it's psychologically. I mean, people talked about the mental health ramifications and the isolation, like see your friends, see their smile. That's so, please do not downplay the impact on mental health. I implore you on that. It's so important. And I feel like we're at a stage that we know so much and the data is out there and doctors are treating these patients. People mentioned zinc, ivermectin, or early on, all these things, vitamin D, and we're in the middle of the summer and supposedly we have this Delta variant running rampant. Well, how do we test that it's a Delta variant, not the regular variant? There's a lot of questions. So I think the right thing to do, the prudent thing to do, would be to give people the medical freedom and medical choice. And
Thank you.
Okay, I appreciate the time. Thank you so much.
Thank you. Sam Johnson, you have your hand raised.
Did you hear me?
Hey, Sam Johnson, 1660 Snowy Owl Drive in Broomfield. I have a son in Boulder Valley School District. I just want to speak up in favor of the mask mandate. Hearing a lot of people now, kind of who aren't educated on what's going on lately. I think we are seeing, hundreds of kids being hospitalized every day across the United States because of Delta now. It's much more infectious, much more dangerous. We haven't had that yet in Boulder, but, I think it's going to come, especially if we don't take some more actions here. I think we, instead of actually just talking about masks, I wish the health department might be a little bit more nuanced or even looking down the road. We're going to need more interventions. Delta is so contagious. We're talking about chickenpox level now. I don't think masks are going to be enough even to stop the surge here. And the other thing is, I saw in the chat somebody saying that cloth masks don't work, and they're kind of right. Cloth masks aren't that effective. We should at this point be moving on to KF94s. Better masks are available for our kids. They should be encouraged to use those and not just a t-shirt gaiter, right? Like the right t-shirt gaiters are not that effective, especially in indoor situations where you're breathing a lot of stale air. I hope, and obviously there's a lot of need here for more education. I think just kind of the hard and fast messaging might be appropriate at sometimes, but we definitely need to try and push because a lot of these people are kind of woefully ignorant of what's going on right now. Thank you.
Thank you. And I did hear someone from the phone try to speak. I apologize. You're still there?
Yes, can you hear me?
I can. Yep. If you can just state your name and your address, please.
Yes, Trinity Fuller, 3095 Meadowbrook Lane in Dakota. I have kids in St. Valley Free School District and Wild RE8. I understand we're all wanting what's best for our kids, and this has not been an easy year. And the only thing that I ask is because what's decided here directly impacts my kid. And I really fully believe that there should be a choice. That's what we have, the medical freedoms. I think we should have a choice. I was terrified of this virus at first. My husband worked in the middle of it and is still working without masks. And when he had to go in, and after there was his team of adults that were quarantined or, tested positive, and we luckily, have never caught it. And, the whole factor is like calling people selfish or calling people names is not helping the fact. Parents aren't selfish because they don't want the kids to be masked. Parents aren't sheep because they want kids to be masked. There is nothing, it just needs to be, I believe, optional. And, the one thing is that people are not mentioning that they do have the lowest risk for this, and yet they're paying the heaviest price. And also on top of this, they just released a few months ago, the Children's Hospital, that we are in a mental health crisis for our children because of the increase in suicide attempts, and mental illnesses. You can't even get your kid into a psychologist right now. And, we have to, everyone wants to put the focus back on the kids. And I just ask for choices, not mandates. Thank you for your time.
Thank you. Anyone else on the phone that would like to speak?
Yeah, I'm on the phone.
Great.
My
Can you
name
please
is
state your name and address?
Simone Smee, 1210 Glassy Drive, Boulder, and I am a K-5 PE teacher in BVSD, and I have kids who are actively participating with masks. I did last year. I was in the building, and for the better part of the year, except for the 6 weeks when we were off from November to December, that block, kids are amazingly resilient, and they do it, and it's truthfully not that big a deal. And we're doing PE, and I hear a lot of people saying what a hardship it is to have a mask on in school, and I understand none of us like to have a mask. Tell me one person who's yippee skippy about wearing a mask. We're not, but we're in a pandemic, and kids are resilient, and kids are amazingly doing it. I mean, just flat out doing it from kindergarten to 5th grade. I also have a teenager going to Fairview High School, and I'll tell you that I'm super excited for her to go back to school, but I'm fine if she wears a mask. I want her to wear a mask, and I want her other students to wear a mask. You know, I agree with mental health that it is a concern, even more for upper kids, high schoolers and such. And I have read those data, and I'm concerned, and I think it really matters about going back to the classroom. But I think we get back to the classroom when we all work together and we stop playing this game about what's good for me and just my kids and just my choice, and we come together as a community. What's better for all of us? We do it for a lot of things. We have speed limits. We have laws against DUI, drinking and driving. We have seatbelt laws. We have a lot of laws that pertain to everyone that are expected to do it for the greater good of the community. No. And so there's always exceptions to everything. I really feel to follow the science. You know, my other child's not in school yet, but her dad's a virologist. He works in New York City in a COVID lab that he runs. And he says, hands down, you want to get the vaccine, you don't want to get COVID. And he's a COVID survivor who's still suffering long hauls and works every day with the COVID vaccine and a level 3 COVID lab. So kids can do it. We can beat this, but we got to do it all together, and we got to think of the larger community and not just a choice or just my kid or
really,
one of
really important.
Thank you.
It is stressful. That's why we have to be educated.
Thank you.
It's life. It's not
Lori, Lori B, can you just state your full name and your address before your comment?
No.
Lori, we hear you. We just need your name and your address. Okay. Anyone else on the phone want to speak?
Yeah, I wanted to speak if you can hear me.
We can. If you can just state your name and your address, please.
Sure. My name is Valerie Bartel. My address is 1009 Alder Way in Longmont. The reason why I wanted to speak tonight is I know that your guidance is going to weigh heavily on the local school districts. What's important to me is continuity in education. You know, the CDC is recommending that those unvaccinated mask indoors now, reversing some prior decision making. And that essentially means all elementary school age kids would have to be masked because they can't, you know, by definition be vaccinated. You know, the AAP is also recommending indoor masking. And I think the repercussion here, if we don't follow these health recommendations, it's going to cause great disruption in education, and it's going to negatively impact the workforce and community. And so this isn't just a parent choice. This is something that we all have to get together on. We have this great case study here in Colorado right now where, you know, masks were, you know, the CDC basically, you know, in April said masks can be, you know, optional if you're vaccinated, and, you know, whether or not people, you know, are choosing to be honest when they go indoors. Cases have been, you know, skyrocketing since that time. So we have a great case study that the mask did work, the social distancing does work, and it just needs to be that extra layer of protection, and these kids can't protect themselves. So, you know, I just want to, you know, make a statement that I'm in support of mask mandates, especially for the school-age kids, and it just seems to exhibit common sense. So, thank you.
Thank you. Anyone else on the phone wish to speak? Okay. Hannah, you have your hand raised.
Hi, I'm sorry, I was trying to unmute myself. Yes, my name's Hannah Montier, and I live in 6 Wolf Creek Drive in Longmont, Colorado. And my son was at a private preschool this last year in Boulder, where they had a mask requirement, and he was 2.5 years old, and he wore his mask, and he went every day, and they had no cases in his class the whole year. There were no quarantines for his class, and he was able to have a great school year and be safe. They were mostly outside and really just able to have that continuity of his education. And I would hate to take those masks away and then our numbers to go up, because even though Boulder has a high vaccination rate, all of our children under the age of 12 are not vaccinated. So in all the elementary schools, this is going to be a problem as cases spread, because they are not going to be vaccinated. And I just really feel like we need to follow what the CDC is saying about masks and try to keep our kids in school so they can be learning and have that socialization. And it's just something easy we can do. If a 2.5-year-old can do it, I feel like we can all make an effort. And I just feel like that's what we should be doing to ensure that the kids stay in school. And that's it.
Thank you. Anybody that we missed that would like to speak that hasn't gotten a chance yet? Okay. The sound of silence. Thank you everyone for your public comments. At this time, we're going to be moving to staff presentations. So we are going to turn off the chat function just so it doesn't distract the staff while they're presenting. And yeah, thank you.
Okay, yes, thank you everybody for sharing your comments, questions, concerns. That was the most public comment I've experienced in my 7 years on the board. So thank you very much, and thanks for taking the time out of your evening. Okay, so item 2 is approval of our July 12th, 2021 regular meeting minutes. There are any motions or call outs, please make them, board members.
This is Brooke.
To approve the minutes.
This is Brooke Harrison. I second.
Okay, motion and a second. All in favor? Aye.
Aye.
Okay, thank you. And then item 3, update on current COVID-19 pandemic.
This is Camille, and to the board, we have to give us a COVID update. Indira, take it away.
Hi, good evening, everyone. I'm Dr. Indira Gujral. I'm an epidemiologist and the division manager for communicable disease and emergency management at Boulder County Public Health. I'm going to be presenting the COVID data update, which will cover the COVID cases and trends, along with some vaccination data. And then our Deputy Director, Lexi Nolan, will be discussing or presenting the public health goals and strategic discussion. Next slide. So we wanted to start off with the key messages from the CU modeling. So CU does modeling for the state of Colorado, and that modeling is shared widely with local public health agencies. The state hospitalizations are slowly increasing. Our reproductive number is increasing from 1.1 and 1.3 in the metro region, which means that the transmission is increasing more significantly in the metro area. There's approximately 1 in every 249 individuals in Colorado who are currently infectious. And the course of the pandemic does vary across the state, with that growth in infections in the metro area and also in the Central Mountains region. Next slide. The Delta variant is a major concern for the state of Colorado. It is now the predominant strain at 100% of, almost 100% of all cases that are coming in are Delta. It is 2 to 3 times more transmissible than the wild type strain that circulated last summer. And it's actually 2 to 3 more times more transmissible than the alpha strain that we have been seeing predominantly this spring. On average, people infected with Delta variant had 1,000 times more copies of the virus in their respiratory tract as compared to those with the wild type. Someone catching the Delta variant is more likely to become infectious sooner, so you're going to detect it earlier, and the spread of the virus is going to be earlier in the course of infection. And vaccination does protect against the Delta variant, and it remains critical to ending the pandemic. Just a close look at the current Colorado data. So this is from the Colorado Department of Public Health and Environment. It is the current epidemic curve. So those areas that are in the light pink, which is the majority of the state of Colorado, are in elevated incidence growth, which means that they've had more than 10 new cases per 100,000 in the past 2 weeks. And there is also elevated incidence plateau happening in the northwest region of the state. And it looks like Mesa County is the only county in Colorado that is looking at a sustained decline. When you take a closer look at Boulder County, the elevated incidence growth chart is on the right, and it's the 3-day moving average, which is showing that the cases are rapidly increasing. Next slide. At the Metro Denver region, you can see the counties that represent the Metro Denver area, and all are showing increases in the 7-day moving average of case rates, and in Boulder is part of that group of increases as well as the other counties in the region. Next slide. Taking a closer look at our Boulder County specific data, the cases are rising and we are seeing an average of 35 cases per day. This is a 7-day rolling average. The graph represents the 7-day rolling average of new cases, and we know that there were probably there were 330 cases that have been reported since August 1st and to Boulder County Public Health, and we do know that less than 3% of those cases are affiliated with the University of Colorado. That is something that we track and trend, but we are not seeing that being a contributing factor in that group. Next slide. Some of you are aware that we have started to move away from the Colorado dial. We now use the CDC Transmission Tracker. A link to that transmission tracker is available on this slide. And the incidence in Boulder County is currently at 80.93 per 100,000. This is up from 39.4 per 100,000 on July 19th. So just within a few weeks, we've seen a significant increase, and that has moved us on our CDC transmission tracker from moderate transmission, which is in yellow, to substantial transmission in orange. And when should we hit over 100 per 100,000 incidence rate, we will be moving into high or red transmission. Next slide. We know that Boulder County is connected to other communities, and many people live outside of Boulder County but commute into the community. We also know that our school districts cross county lines, and hospitals that are located within Boulder County serve individuals in other counties. So as we monitor what is happening in Boulder County, we are also monitoring what's happening in our neighboring communities, such as Larimer and Weld, who have moved into the highest risk category of the CDC Transmission Tracker. The case trends are steadily increasing among all age groups, and of significance is the increase in the number of cases who are of 0 to 9 years of age. They are represented in the light blue. We are notified actually by the state health department this week that our incidence rate for 0 to 9-year-olds was the highest in the state and heading in the wrong direction. The greatest number of cases in total for this week were among the 23 to 34-year-old age group, which also has some of the lower vaccination rates in our community. Next slide. In our preparation to look at schools reopening, we wanted to do a comparison of the age groups 0 to 5, 6 to 11, and 12 to 9, a comparison between this summer and last summer. And what we see is that children are impacted by COVID as shown in the chart below, comparing the 7-day incidence rates for children in those 3 age groups for the 2 time periods. So the 2021 time period represents the dashed lines, and the summer 2020, which is the wild type strain, and when masking was in place, is represented in the solid lines. The graph demonstrates that the spread of the virus is accelerating rapidly this summer among the 0 to 5 and 6 to 11-year-old age groups, and we did observe statistically significant differences between the 2 time periods for both age groups. The rates for 12 to 19-year-olds were not statistically significant between the 2 time periods. However, the rates remain the highest among school-age children. And we know that among the 12 to 19-year-olds, 62.8% of this group have received at least 1 dose of vaccine. So what this graph is suggesting is that the Delta variant is behaving very differently than what we saw last year with the wild type strain and the alpha strain, and that masking may be contributing significantly to this. Not having masking this summer may be contributing significantly to the transmission. Next slide. This graph shows the percentage of cases by race and ethnicity by week. The number of cases is rising overall within the past weeks, and in the past 7 days, 10% of our cases have been among Hispanic Latinx community members, who represent 14% of the population, and 78% of our cases have been among white non-Hispanic community members, who represent 77% of the population. What this is suggesting, the past few weeks are suggesting, is that we are finally starting to see fewer disparities, particularly in Boulder County, which is something that we have been working towards for the past year and a half. This slide just represents all the municipalities in Boulder County, and you can see that all of the municipalities are being impacted by COVID. That includes the city of Boulder, Longmont, Lafayette, Louisville, Superior, and other municipalities in unincorporated Boulder County, which are in green. Next slide. When we take a closer look at hospitalizations, our hospitalizations are around 20 is the last I saw. Hospitalizations for COVID. I just want to remind everyone that our hospitalization rate goes up 2 weeks after we start to see increases in cases. So we are closely monitoring how this increase in cases over the past 3 weeks is going to be impacting our hospitalizations. We do know that several children are in the hospital in Boulder County. Next slide. Our deaths do remain low. We have had 7 deaths since the beginning of May, and we've also experienced 2 recent deaths, one in a long-term care facility, which is identified in orange. Next slide. The 7-day positivity increasing. What we're starting to see is an increase since June in the 7-day positivity. We are getting between 900 and 1,000 individuals who are being tested each day, which is good. We still want to promote testing and ensure that everybody has access and knows about free testing. I wanted to share on the next slide that the COVID testing has shifted. It used to be at the Boulder County Fairgrounds, and it is now at the heart of Longmont. So just wanting to advocate for our board to help get that message out that free testing is available in Longmont at the heart of Longmont. The Stadio ball field still remains for free testing, and we partner with Boulder Community Health to ensure that we can have drive-through testing in the mountain communities up in Netherland. Next slide. So we often say that our vaccination rates are really high, and they are. And if you look at the dashboard, you can see that 80% of the population there has at least 1 vaccine dose. What I think is really important to remember is that that's just of the eligible population. When you look at the total population for Boulder County, our total population vaccination rate is actually 64%. So that 80%, we are doing a really great job as a community. We are really, pushing for individuals to get vaccinated, and the community has done an awesome job. And we still have a number of people who are not vaccinated. I'm going to go over those numbers in just a few minutes. Next slide. Our vaccination focus definitely shifting to younger age groups, particularly the 12 to 14, 15 to 19, 20 to 24 age groups. And as individuals in the 25 to 34, they are starting to increase, much like the older age groups. So we're really excited to see that. Next slide. The data on the unvaccinated and eligible. So as I mentioned, we do have a significant number of people who are still not vaccinated. Approximately 97,000 or 30% of Boulder County residents are currently not vaccinated. That is either due to ineligibility, meaning they're less than 12 years of age, or for other reasons such as choosing not to be vaccinated. Approximately 39,500, almost 40,000 Boulder County school-age children between the ages of 5 and 19 years of age are either ineligible, 23,500 of them are ineligible, or unvaccinated, 16,000. This represents, these school-age children represent 41% of the total unvaccinated population. Among the unvaccinated children 12 to 19 years of age, these are individuals who are eligible but are not vaccinated, 40% are children of color, meaning they are not white or of Hispanic ethnicity. And among children 12 to 19 years of age, municipalities with less than 70% of children with one dose include the city of Boulder, Lafayette, Longmont, and Jamestown. So we have a lot of work to do within this 12 to 19 age group, and we have some town halls coming up in the future, and also we are working closely with our school partners and our community ambassadors to really encourage families to come and get vaccinated, particularly for those 12 to 19-year-old age group. This just represents the total Black, Indigenous, and people of color who are unvaccinated by age. The biggest chunk, or 75%, are represented in blue, orange, and gray, and that represents that age group between 12 and 39 years of age. We see a very similar distribution among non-white, non-Hispanics who are also unvaccinated, in which we are really working hard to focus on that 12 to 39 years of age. Our vaccine equity continues through until December of the end of this year, and our focus is on our priority populations. So we have community ambassadors who are trusted messengers, trained and trusted in the community, and they are focusing on priority populations, which include our Latinx community. We have 3 Latinx serving community organizations participating and supporting this work. We also have our LGBTQ plus community being represented and having advocates out in that community. We also know that our mountain communities have often less access to getting vaccines, so we have a alliance that is working with us to get the vaccinations available to the people living in the mountain communities. And then we've been working really closely with the community serving the intellectual and developmental disabilities. And this is really important. These are our priority populations, and we feel that our success as a community has been this partnership with these community ambassadors, and that we are hoping that this will have a long-term impact in creating stronger community engagement with them. Thank you.
Hi, Indira. This is Brooke Harrison. Before we move on, did you get any of the data broken down by vaccinated versus non-vaccinated? So, for instance, the number of cases, the number of hospitalizations. Do you have those by vaccinated versus unvaccinated?
Yes. So the state health department is going to be releasing a state dashboard in which they will be releasing the data on the number of cases and whether they've been vaccinated or not. So we are waiting for the state health department to release that data.
Got it. Thank you. Oh, and one quick clarification. So 68% of 12 to 19-year-olds have one dose in Boulder County?
Lexi, let's go back to that slide. I think that is important to clarify. I think we go back one more. Yeah. So if you look at the total population of Boulder County as the denominator, then approximately 64% of the total population of Boulder County has been vaccinated.
Oh, sorry. I'm asking only 12 to 19.
Oh.
I think this is the closest we have in this presentation, but we can definitely give you that number. It's somewhere
Okay.
between 60 and 74%.
Got it. Thank you.
And Indira, this is Greg. Has our tracking of kids with COVID changed at all since last summer?
No, we still use the same reporting mechanisms. So when a case is identified, it is mandatory reporting to the state of Colorado, and then we still do the same case investigations.
Okay, great. Thank you.
Good evening, Board of Health. Lexi Nolan, Deputy Director at Boulder County Public Health. I'll apologize starting out that my slides aren't as visual as Indira's are, and there's a lot of content in them, but I hope that they are useful to you in understanding some of the considerations that we gave in interpreting the data to think about what our critical strategies for moving forward to best protect our Boulder County population, and particularly in this discussion, children in Boulder County moving forward in the current context. So these concerns came out in Indira's presentation, but I'll just review them really quickly to set the stage so our heads are all in the same space. In Boulder County, we are seeing significant transmission level, and we are surrounded by counties that have high transmission levels. We also know that cases are likely to be underestimated as more and more people move to using at-home tests, and that information doesn't flow into our state databases. We know that rates among children are significantly higher than this time last year when they were being masked and before we had the Delta variant. We know that the overall Boulder County population vaccination level is at 65%, around 100,000 people. 40,000 ineligible children, 13,400 immunocompromised folks who can't hold a vaccine, additional adults and children who medically cannot take the vaccine. We now have the Delta variant, which is showing increased viral loads, breakthrough cases, higher contagiousness, and spread even by folks who are vaccinated. Looking forward, we are also looking at the potential threat of the Lambda variant, which has now been detected in 42 states. We do not know what the full impact is likely to be in terms of breakthrough and vaccine effectiveness. And it's imperative to continue to suppress the virus from moving through our community too quickly. We also know that there's potential for more serious variants to emerge in the coming months. So when we think about our public health goals, we really wanted to kind of identify what are our North Stars for developing policy and thinking about how do we wrap our hands and our heads around these problems. So number one is preventing unnecessary deaths and significant illness. We know that we've had 7 deaths since May so far. We also know that Boulder County deaths are at about 78 per 100,000 throughout the pandemic, compared to a US rate of 188 per 100,000. That's great news. We also believe that that's partly due to the aggressive mitigation approaches that we've taken and the enormous support from the community participating to do what they could do to help make sure that they were safe, that they weren't transmitting to especially older people, and that they were paying attention to all of the various mitigation strategies that they could enact themselves. We know that about 1/3 of cases are expected to result in long-lasting effects for folks, long-haul COVID. And we are increasingly seeing what that looks like in practice and being able to understand better the kinds of ongoing disability that some folks suffer after having COVID. We know that some kids experience multi-system inflammatory syndrome in children and neurological impacts. And we also know that several children in Boulder County are currently hospitalized with COVID. Our second public health goal is not to overwhelm the health system. And keep in mind that hospitalizations are a lagging indicator. We are seeing increasing hospitalizations, especially younger, excuse me, younger children, younger people, and sicker people. CDPHE's models suggest that hospitalization rates are expected to peak in December. That's a bit of a long way off. Boulder County ICU beds are currently between 60 and 87% occupied. Good Samaritan, one of our flagship hospitals in Boulder County, is at 87% ICU beds occupied currently. We know that
Sorry.
Boulder County.
Sorry to interrupt you. Can I ask a quick question about the ICU occupancy? Do we know how much of that is by COVID versus other ICU use?
I can send you that information. I don't have it at the tip of my fingers.
Okay, thank you.
We know that our Boulder County hospitals serve nearby counties that are experiencing high transmission rates, so we are particularly concerned for them right now, given the high ICU bed occupancy. We also know that beds aren't the only indicator that could be a limiting factor for being able to support the health system. We know that staffing shortages are beginning to emerge across the nation, including in Boulder County, and they may become as relevant to the ability of the health system to support COVID response as tracking beds. We also know that the public health department is understaffed still and about to move into a surge response given the number of cases that we are seeing.
This is Brooke again. One quick question. So the high transmission counties, do they also have a much lower vaccination rate than Boulder County?
Generally, yes. We can send you specific information on that if you're interested.
Okay, thanks. I think I can look it up. Thank you.
You bet.
Can you send that to everybody?
You bet. Okay, and our third public health goal, particularly relevant for the conversation tonight, is how do we safely return to normal activities in Boulder County? We know that we've been kind of really focused on COVID for the last year. We are beginning to have much better sense of what some of the trade-offs are of some of the strategies that we use, and that there are competing needs in our community, from mental health needs to our ability to continue to support commerce and exchange and be a community that is able to come together and be one. So this slide is particularly relevant to the school context under discussion tonight. Currently, we're seeing higher case rates than the beginning of school last year when we had masking and no vaccine. It's not operationally possible at this point to sort and isolate vaxxed students from unvaxxed students, and the Delta breakthrough poses transmission risk even among vaccinated students. We know that the 15 to 19, the high school group, the vaccination rate is only 59%. We also know, and this is really important for our strategy, that there is no hybrid option for this year in the school districts. They are not offering an online learning opportunity for students who are removed from school due to quarantining or isolation. So we have to get this right the first time. We have to keep kids in school. And to do that, we have to make sure that the case transmission rates in the school is low so we can keep them in school. We also know that we need to minimize school staff work burdens related to COVID containment. Our schools partners, our health partners in the schools, our teachers worked hand in hand with us last year. They did yeoman's efforts. They were heroic. They also worked too hard, more than any of us want to have to work. And so we are also thinking very carefully about what are the strategies that also lighten our loads a little bit, so that we aren't having to scramble and work so hard, and we can get the same benefit by using a different set of strategies. So when we were thinking about school masking public health order considerations, we really wanted to pay attention to a few things. One is that recognizing the harms of reduced in-school learning last year. We know that a lot of students suffered significant learning losses and that these losses were disproportionately felt in different groups in the community. We know that all of our students experienced socio-emotional and mental health impacts, and that there was a crisis declared by Colorado Children's Hospital that was linked not to masking, it was linked to being out of school. It was linked to the high number of quarantines required because of transmission and exposures in school. We also know that mass quarantines put burdens on school and public health staff and working parents. Second, we wanted to recognize the impact of transmission to unvaccinated families with the Delta variant, including the health of young siblings, health-compromised family members, and those who can't get vaccinated yet. We also wanted to recognize the impact of family security in relation to hospitalization and costs, deaths, employment, and life disruption. These are unnecessary at this point. We should be able to contain this kind of transmission. Finally, we wanted to recognize that a layered mitigation strategy is the way to keep kids in school safely. And if we're removing a lot of the quarantining protocols and standards to keep kids in school and minimize disruption of staff workload, we need to keep the other safety layers in place. Also, I want to be very clear that there is an opt-out opportunity of masking for children who have medical reasons for not being able to wear a mask. And I think the point is just to say we want to make the right choice for containing COVID the easy choice, the choice that people go to. And the exceptions are have to be pursued for a smaller number of children who need those exceptions. So just to talk a little bit, when we think about these layered mitigation strategies that are recommended by CDC, CDPHE, American Academy of Pediatrics, I mean, the list goes on and on. Layered mitigation strategies are the way to do the work. We started to think about what are the various burdens of some strategies compared to less burdensome strategies and essential functions of public health. And so we kind of made a spectrum that goes all the way from case investigations and contact tracing and isolation of cases, which is a public health obligation. We will always do that. That is essential. To hygiene, not seriously burdensome. Indoor ventilation, which the schools have now implemented. We do not have to take active action to have that advantage, and we are very grateful for that work. Voluntary vaccinations, testing, and indoor masking. Relatively unburdensome compared to what we see at the other end of the spectrum. Community lockdown, limited gatherings, ordered remote work and learning, vaccination mandates, and broad quarantines. And what we really want to do is focus our strategies on this left side of the spectrum, on less burdensome strategies, so that we don't have to implement those more burdensome strategies. And we're particularly concerned about this because we are going into fall, because we're going into back to school, because we are all of these reasons, because we are seeing increased rises and all of that. So just to mention, on the radar, we are also looking at strong recommendations for public indoor masking. We are seeing what we are seeing in the community conversation, in the national conversation, in the state conversation, is increased public indoor masking mandates by individual counties, by federal, county, and municipal government agencies, and by businesses. And this is happening even in Boulder County. They are kind of one-off approaches. We are also getting requests for alignment on masking requirements from Boulder County businesses, from municipal and county government agencies, and from our health systems, from our metro mayors, and from our metro local public health agencies, which are strongly interested in aligning, as we always are. Second, vaccination mandates. This is a discussion among local public health agencies across the country, in particular for staff. We are also seeing increased vaccination mandates for staff by federal, county, and municipal government agencies and businesses. Some businesses are requiring customers also to be vaccinated, including in Boulder County, and we are hoping to see the license for Pfizer in early September, which will also open up, we think, much more interest in accelerating vaccination mandates. Did someone have a question? No, okay. Finally, we also wanted to provide some space for an update for our higher ed partners at CU. So I will turn the stage over to Pat and Jennifer.
So thank you, Lexi, and thank you to Camille and to Indira for the work that you've been doing and the other folks at BCPH, and thank you to the board for giving us an opportunity to appear. Given what we saw in the last academic year, we thought that it would be appropriate at this point in time to give you an update on some of the things that we are planning on doing coming into the fall semester. In about 10 days, we are going to be having students return to class on, well, actually it's on August 23rd, which is also my 51st birthday. So the students are coming back on my birthday, which makes me kind of happy. And we're preparing for them to be able to reintegrate into our campus community in a way that was not possible last year. In contrast to what we heard in some of the other discussion tonight about some of the K-12 population and their eligibility for vaccines, we are very fortunate that in the CU Boulder community that our student population is eligible to be vaccinated. Accordingly, we have created a vaccination requirement for our faculty, students, and staff for the fall. They need to inform us of their vaccination status or claim a religious, medical, or personal exemption through the processes we have established through our public health office. Currently, we're seeing those responses come in. We have about 65% of our faculty and staff who have responded to this point in time, and about 30% of our student population. We expect a large surge in that reporting to happen in the days to come as we get closer to the fall semester starting. The good news is that we are only seeing about a 5% rate of people who are claiming those exemptions, which means that we are very hopeful that at the time that the fall semester starts, that we'll be over 90% of our population having been vaccinated. Our public health office will continue to remain responsible for attending to the public health requirements for the campus, and we have just renewed a memorandum of understanding with BCPH that allows us to continue our status as a closed system for contact tracing, case investigation. This has been part of a very beneficial partnership with Boulder County Public Health over the course of the last year, and we've also participated in the agency administrator meetings with the local jurisdictions and the municipality so that we are informed of the status on the ground and able to participate in decisions. We greatly appreciate the work that the board is doing both to protect the community at large, but also the K-12 population in its consideration of the orders today, and would be happy to address any questions that you might have about our return to campus in the upcoming days.
Hey, Pat, this is Greg. Can you just repeat one more time? What is the vaccination requirement?
The vaccination requirement is that by September 20th, all of our students, faculty, and staff need to do one of two things. They either need to confirm with us what their vaccination status is, or they need to seek an exemption from the campus. We have consistent with what is often done in the K-12 populations, exemptions that are available for medical, religious, or personal belief reasons. But similarly to what we see with the MMR vaccinations, which we also require of our campus population, We ordinarily have a high degree of uptake for the vaccination, which is why I believe that we'll likely to be above 90% of our overall population vaccinated when the fall semester starts. The reason that we have the September 20th deadline is because we have some students who are coming in from international who may not have been vaccinated before they arrived, but we certainly anticipate that the majority of our students will arrive already having been vaccinated in their communities of origin, and we will also have vaccination available for them to be able to receive doses so that everyone will have the ability to be fully vaccinated by that September 20th deadline. Or, I'm sorry, I just got a text. It's September 15th, not September 20th. And thank you to Jennifer McDuffie, who heads our public health office, for correcting my mistake.
One quick follow-up question. This is Brooke. Will you tie if a student is claiming a personal belief exemption, but has received all other vaccinations to be a student, will they be granted a personal belief exemption?
They will.
I'm just curious how much questioning will go into this.
The short answer is we do not do cross-referencing on the vaccination to determine the strength of one's personal belief or religious belief. That's an area as a public institution that could expose us to some challenges. So we are relying on their veracity to be able to pursue those exemptions.
If the vaccination rate turns out to be below 75 or 70%, what will the university's action be at that time?
I'm very hopeful that we won't be there, given the tracking that we've seen so far, but we would have to determine whether or not we would have to impose any additional requirements on our method of operation on the campus to be able to adjust for the rate of vaccination that doesn't meet our expectations.
Okay, I'm just concerned seeing that we're seeing that that age group, that 15 to 35 age group, is not being vaccinated at high rates. So yeah, I was curious what the backup plan was if you ended up at a below threshold of vaccinations.
We're still working through that with our pandemic response team, but if things track as they do ordinarily for us with our vaccination requirements, I'm confident based on what we're seeing in the modeling that we're seeing from our public health and epidemiological folks that will be above that threshold.
Thank you all very much.
Okay. Thanks to everyone for those very important, critical updates. Any other questions from board members before we move on to the next agenda item? Okay, hearing none. So we'll move to item 4, which is approval of Public Health Order 2021-07, requiring facial coverings indoors for all individuals ages 2+ in childcare, camps, and pre-K through 12 school settings.
This is Trina Ruland. I'm going to present item 4 on behalf of Director Rodriguez as well as Boulder County Public Health staff. However, if the director wants to chime in at any point, I welcome her to do so, as well as Dr. Urbina, our medical director. If you'll give me a moment, I'm going to pull up my PowerPoint and I will try to move slowly so we can go over the details. And if the board has any questions while I'm presenting, please feel free to chime in and ask while I am presenting. On the table for the board's consideration is Proposed Public Health Order 2021-07. The title of this is Requiring Facial Coverings Indoors for All Individuals aged 2 and older in Childcare Camps, Preschool through 12 School Settings. I'd like to give the board a brief overview of the current status of legal orders in Boulder County, specifically with respect to federal orders and state orders. There is currently a CDC order in effect through, I believe, mid-September, requiring age 2 and older to mask on public transportation. This order does include school buses. And so regardless of the action this board takes, children on school buses will be required to mask under that CDC order. At the state level, Executive Order D 2021-122, which was recently extended by another Executive Order D 2021-125, keeps the disaster emergency declaration in effect. There is also CDPHE Orders 2020 and 2038, which still and continue to require face coverings in homeless shelters, prisons, jails, and healthcare facilities for not fully vaccinated individuals, and recently require face coverings for all individuals or most individuals in long-term care facilities. Before I jump into the proposal, I want to give a brief overview of the 2020-2021 school year so that the board is informed of the status quo. For that school year, our two major school districts, St. Vrain Valley School District and BVSD, as well as many private schools, required masks for ages 3 and older for the entirety of the school year. Many of our early childhood education, abbreviated with ECE in my slides, also required masks for children as well as staff. The staff masks were required by state order, as well as for individuals age 11 and older. Quarantines were required under the state order, and I want to emphasize something here. Sorry, is there a question?
Had a
From the
chance.
board?
I'm just trying to stay up for this.
Okay. Can I have participants mute, please? Thanks. Under the state order, quarantines were required, and the types of quarantines that were required were routine classroom exposures, which required quarantines for everyone or nearly everyone in a given class. The current situation is that we have guidance from the federal government as well as the state government on these issues. As of August 5th, 2021, the CDC released new guidance specific for K through 12 education as well as early childhood education. And I want to point out some of the things that the CDC emphasized, which Dr. Nolan emphasized in her presentation as well. Students benefit from in-person learning, and the safely returning to in-person instruction in the fall 2021 is a priority. And just a reminder, this is directly from the CDC, and that vaccination is the leading public health prevention strategy to end the COVID-19 pandemic. And as a reminder, under 12 is not currently eligible for the vaccine. The third bullet point from the CDC is that due to the circulating highly contagious Delta variant, CDC recommends universal indoor masking by all students age 2 and older, staff, teachers, and visitors to K through 12 schools, regardless of vaccination status. This recommendation applies to counties across the United States, regardless of their transmission levels. The transmission levels do become relevant for whether or not the CDC recommends indoor universal masking. The American Academy of Pediatrics, abbreviated here as AAP, also recommends that all students older than 2 years and all staff should wear face masks at school unless medical or developmental conditions prohibit use. The AAP also made these notes, which largely align with the CDC, about continued concerns for variants, protection of unvaccinated students, eligibility for vaccination, and potential difficulty in monitoring or enforcing mask policies for those who are not vaccinated. Our proposed Public Health Order 2021-07 would require face coverings for all individuals age 2 and older. This requirement would apply in school buildings, indoor childcare settings, indoor youth sports, in indoor youth activities and camps. This requirement is regardless of vaccination status. I'll also note that there's no upper age limit on this requirement. It's age 2+, although the goal is to keep students in school and keep children with the ability to stay in their childcare settings. CDPHE has also implemented guidance at the state level, which largely mimics the CDC. Why I put this slide in here is because the CDPHE guidance specifies the locations in which the CDC recommendation for universal masking should apply. And it's this long list of things. And the goal of this proposed public health order on the table is to put into an order form the CDC guidance, which aligns with the AAP guidance and the CDPHE guidance. And so we will incorporate these terms, these locations into the order. I apologize, there's a duplicate slide there. Just breaking down the specifics of the order for you. So there's two components to the order. One applies to school buildings, and the reason for pulling out school buildings is because our large school district have administrative buildings in addition to their instructional buildings, and this order is not meant to cover the administrative buildings where students do not attend and faculty or staff do not come into contact with students. So it's covers school buildings where instruction takes place or extracurricular activities take place. In those buildings, masks would be required for age 2 and older for everyone, regardless of vaccination status and regardless of the purpose of for which you're entering the building. So it would apply to visitors, staff, students, and anyone participating in extracurricular activities indoors. The second component of the order is meant to cover groups of youth age 2 and older who are participating in activities, organized activities together, or in childcare settings or in camps, whether or not those camps are licensed or unlicensed. It also covers things like guest childcare facilities within gyms, recreational facilities, and it also covers indoor youth sports. We also propose adding to the order a mirror of the CDC's order, which is what this statement is, that all individuals age 2 and older are required to wear a face covering on public transportation. That's going to be in effect regardless of the action this board takes. I'd like to talk briefly about the proposed exemptions for this public health order. Individuals under the age of 2 would not be required to wear a mask, and it's the recommendation of public health that they not wear a mask. And significantly, the order would also have an exemption for individuals who cannot medically tolerate a face covering. In that event, if there is a student or a staff member who cannot medically tolerate a face covering for whatever reason, they would work with the organization, their school district or their private school, to go through a process defined by that school to see if they would qualify for that medical exemption. There's also a list of exceptions, and the difference between exemption and exception is that an exemption applies to a person, an exception would apply to an activity. So there are exceptions to the mask order, for example, for the hearing impaired, where visual on a mouth is essential to communication. There's an exception for being seated during meal or snack time while individuals are eating. There's an exception for receiving medical services. If you need to receive medical service while you're within a school, you can remove your mask if it's necessary for receiving that medical service. There's an exception for swimming. So in the event that your mask would otherwise get wet, you wouldn't be required to do that while you're undergoing a swimming activity. There are some limited sports exceptions, and what I'll say about this is Boulder County Public Health issued sports guidance last fall, which defined sport by sport scenarios under which a mask was and was not required indoors. And this would largely adopt that sports guidance moving forward. There would also be an exception for playing an instrument for academic credit that cannot be played with a face covering on, for example, a wind instrument. There's also an exception for being alone in an enclosed room. So for example, a teacher in their classroom alone without any students or other staff could, of course, remove their mask while they are alone. I'm going to turn this over to Taylor Carranza. The second part of this order is that we would adopt Boulder County Public Health School and Child Care guidance into the order, and that guidance would have certain recommendations related to quarantine, isolation, etc. And it would also have some recommendations that are not actually requirements. Taylor, if you want to go ahead and start.
Thank you, Trina, and thank you, members of the board. As Trina said, my name is Taylor Carranza, and I am COVID-19 Education Liaison and Policy Specialist. As Trina indicated, that part of this order would include a link out to hosted on our website, the Boulder County Public Health School and Child Care guidance. This is taking the place of similar guidance that was offered at CDPHE last year in their mandates. That would require layered mitigation strategies similar to those required last year, in addition to the masking components that Trina covered. If you could continue, Trina. Here is a table of what those requirements versus recommendations would be. Everything that is above that line required is something that was required by CDPHE last year. So these are all familiar mitigation strategies for our school partners, as well as are the recommended layered mitigation strategies by both CDC, CDPHE, and the Colorado Department of Education. In there are components such as cooperations on behalf of the schools and childcare settings, in case and contact investigations, and cooperation in enforcement of quarantine and isolation, along with components that are specific to schools, such as encouraging social distancing as much as possible, improving ventilation, symptom screening, and following return to learn, which includes testing requirements for ill students to return to school, among other more routine pieces. Beneath the line are recommendations are testing programs, including screening testing and post-exposure testing, which I would like to share that we have workings in place with the school districts to pilot some post-exposure testing programs so that we can be gathering data on how effective our quarantining and mitigation strategies are as we are going into this new school year, as well as to try out some new logistics with those type of testing programs that weren't in place last year to avoid putting undue burden on the school districts. And private schools and childcare centers. And then lastly, as Trina and everybody has highlighted throughout this entire presentation, the promotion of vaccine when available and age group appropriate, as it is our most effective tool. If you could continue, Trina. The other component with this plan, and this is not a part necessarily of the public health order itself, but a part that goes hand in hand with it. As Lexi indicated, and Indira, that our number one goal is to have students in school, that we saw major negative health impacts for students who are not able to be in school. So our goal is to take the lessons that we learned last year, and after reviewing the updated CDC guidance, CDPHE guidance, and data from the previous year, to change our approach in ways that make sense, paired with layered mitigation and masking, that those are really key components for us to be able to keep more students in school for more time. So with those key components of masking and layered mitigation strategies, we believe that we could reduce quarantines in schools by up to 70%. And that would include reducing down to potentially no quarantines in routine classroom exposures in 1st through 12th grade. That would be dependent on an exposure meeting the definition of a routine classroom exposure as is defined by CDPHE, but is essentially a seated classroom without any exceptions of high-risk activities. We would be looking at reducing the definition of a close contact to align with CDC's update as of 2 weeks ago, to 3 feet per 15 minutes over 24 hours, which is essential that both parties are masked to meet that definition. As well as we would continue to monitor athletics, which have continued to be our highest risk spreading locations in all school settings. So we will continue to monitor athletics on a case-by-case basis and implement the lessons that we learned last year about which athletics events are highest risk and what type of transmission we see. And then once again, a reminder for everyone that anyone who is fully vaccinated and asymptomatic does not have to quarantine. And that we would continue to, our epidemiology team will continue to monitor for evidence of transmission and react as we see changes in data and trends in transmission. That is all I have, Trina.
Morgan, I see you have a question.
Thanks. Yeah. Well, two actually clarification. One is that this is only applying to indoors, right? So that students would be able to take off their masks when they go outdoors.
That is
and
correct.
another, thank you. I think that was, yep. And then the part about anyone who's fully vaccinated and asymptomatic not having to quarantine, that seems to be, I don't know, just from what I'm following, it seems like asymptomatic vaccinated people are still able to shed virus. Is that right? And potentially spread the virus based on what we're seeing?
Yeah, I'll be happy to take that, board member. It's very rare that cases do become breakthrough cases, and it's still less than 1%. But if a vaccinated person does get the infection, they still can spread the virus. And that's all the more reason why we think that masking indoors is essential for unvaccinated and vaccinated folks.
Got it. Okay. So the thought is that the quarantine wouldn't have to apply to somebody who was vaccinated, even if they were able to spread the virus because they would be wearing a mask, that would be mitigated. Is that the...
That's correct. It's going to reduce it, not obviously eliminate it totally, but it's certainly going to, all masking is going to, and all the layers that Taylor and Trina went through certainly will reduce the spread of virus indoors.
And if I could add that that is in alignment with CDC's current recommendations. They have recently added a recommendation that fully vaccinated asymptomatic people who have a known exposure should seek a COVID test after that exposure. And we are adding that to our recommendation letters to notify people when they have come in contact potentially with somebody who has COVID-19.
I see. So if you test positive for COVID-19, even if you're vaccinated, then you would quarantine?
Correct. That person would isolate.
Even if you're asymptomatic?
Yes.
No, pardon me, if I can add to that, Taylor. If you are testing positive and have been vaccinated, you are going to be isolated.
Got it.
And so essentially, you have the infection, and we want to remove you from the school setting.
Got it. Okay. Thank you for clarifying that.
Can I ask a question? How is the infrastructure throughout the county compared to last school year for testing? I have this kind of, we've obviously seen the community testing sites go away, and a lot of the commercial infrastructure, pharmacies, doctors' offices have really built up their vaccination infrastructure. And I'm just curious, like how easy, and for schools, maybe it's an entirely separate program and they will have adequate testing. I'm just curious about that.
I can speak to that a little, but Indira, I imagine, might have more to add. But Boulder County Public Health testing, as was highlighted earlier, we continue to offer testing in our community sites in both Boulder and in Longmont, as well as weekly available, I believe, in Lyons and Nederland. But in addition to that, Boulder Valley School District plans to continue to offer COVID check testing, both at a central location at Centaurus High School, as well as their mobile clinic that will go to schools on various weekdays. And then in addition to that, the state has indicated they are providing a lot of funding and free Binax at-home testing options and are accepting more and more of those at-home antigen testing options, particularly in school. And there's plans for robust funding from the state around that for the coming year.
Thank you, Taylor.
This is Brooke. I had a couple of quick questions. You answered most of them through your presentation. But what about indoor sports facilities that are extremely well ventilated? So like soccer bubbles and tennis bubbles where you have a 75% air exchange per minute or something ridiculous like that. Are those exempted, or are those going to also require masks? And additionally, some of those facilities are mixed use, so adults and children. So how would that work if it's outside of school?
That's a great question. I'll let Dr. Urbina speak to the science. I'll speak to how the proposal is written. We would refer to the state guidance, which defines indoor versus outdoor, and that is based upon how many walls and the airflow between those walls, I believe. Not necessarily on the ventilation. I'm sure that's something we could explore further, but would have to defer to the experts on that issue. And I'm sorry, I can't remember this. Oh, the mixed ages. So the way the order is written is it's intended to get aimed at the overall goal is to keep kids in school and to reduce these quarantines by reducing transmission overall. So with that in mind, you know, if a facility has a sports club, a youth sports club, the expectation would be that everyone is masking while that youth sports club is practicing. If that facility later hosts an adult sports club, then they're not going to be subject to this order. So it's going to be activity dependent. And that's why we wrote it as those two separate requirements, one for school buildings, which are almost always used for youth, and one for that's activity based.
I can speak briefly. I think the challenge is your question is largely theoretical. We don't have very strong evidence for transmission in those large, well-ventilated situations. But what happens, as you know, is that people congregate in the stands, people congregate on the playing field or surface, and so the chances of having increasing transmission is greater as you get closer together. So that would also apply to these facilities as well. And you do make a strong case that we probably would recommend indoor masking for both adults and children in that setting, regardless, because of that increased risk of transmission. Obviously, there is transmission outdoors as well, but it's certainly a lot less likely than in an indoor setting with good ventilation.
I have one other question as well, because I think this was basically the end, correct? The slides.
I have two more slides. Would you like me to do those first?
I'll let you do your last two and then I'll ask. Thanks.
Sure. Another component of the order follows what prior masking orders have required, which is a signage requirement. And this signage requirement would be for school buildings, childcare facilities, and those facilities that host the youth activities that are covered under this order. There's already a lot of precedent for this from the state masking order that was in effect until, I believe, May or June of this year. And then the duration of this order would be until rescinded, modified, or amended by Executive Director Rodriguez, with the expectation that Boulder County Public Health intends on monitoring the data at least monthly going forward, this specific data with respect to age 2 to 18 and these child care and school settings. And that's the end of the presentation if you want to jump back in, Morgan.
Yeah, this is Brooke. So I guess I actually have a couple of questions. So the duration, so until rescinded or with monthly monitoring. So what is the trigger point to rescind it? So for example, we are going to impose this on a group that is already actively being vaccinated. And so they're at a 59% rate. If they hit 75% vaccination, would this be rescinded then for the high school population? I guess I'm just asking what
That's
the
also my
trigger will
question,
be.
Brooke.
Yeah.
Director Rodriguez, do you want to answer that one?
Thank you, Trina. We did not want to provide the public with any sort of promises that we couldn't keep in this order. And we do know that our projections show that hospitalizations are going to likely spike by December. With that said, certainly we are going to continue to encourage, especially our high school population, to get vaccinated. But I don't think we have a magic number at this point, especially since we know that it's challenging for our districts as well to have separate policies. So for example, even if we consider our middle school population, whose ages tend to mingle relative to the current eligibility for vaccinations, that has been the challenge. And so at this point, and to keep young people in the classroom, certainly separating out high school would seem commonsensical since they are the ones eligible. But overall, I think our goal is definitely to monitor the activities relative to vaccination rate, and then consider the overall health of the community in our decisions. And I don't know if Dr. Urbina has more to add to that. I wish I could give a magic number to the community and to the board on this one, but I think, as we know, this has been and continues to be a moving target for us. We're constantly pivoting with new information and new ways to fight this pandemic. And I would be remiss if I gave specifics at this point. Dr. Urbina, any more to add?
Thank you, Director Rodriguez. This is a very challenging question. You know, we're going to be watching the data very carefully. I think that we've given you a good data set, you know, a number of cases, vaccination rates, hospitalizations, to trying to monitor. And I think that those monthly and of course, we're going to be working with the schools very closely to look at quarantine numbers and outbreaks. So I think at a future Board of Health meeting, we'll be sharing that data, and then we'll have that honest discussion about where that endpoint is. And I'm hopeful, whereas we all are, that we'll keep kids in school, and these mitigation strategies, layered mitigation strategies, as Taylor, Trina, and Lexi have stated, are going to work. You know, we're confident that there's good science associated with this, and then we're going to be monitoring that data very closely. Thank you, Director.
I have a question. So we're hearing from the board, and this is awesome because we're all listening in. At what point do we get to, as the public, put in our information and our guidance that we think is relevant to help make a decision? Because at this point, we have all been listening in, and we're very respectful, obviously.
This is Kate Haywood with the Boulder County Attorney's Office. Unfortunately, there is no Q&A portion of this meeting for the public.
So I have a follow-up to the response to no trigger to end. I think what I'm hearing also from the community is a lot of concern that there isn't an end in sight. And so if we pass this and put forth this public health order, that it gives almost an indefinite power to keep the mask mandate regardless of vaccination status. And so I think I would find the public health order easier to pass outright if we did have some sort of trigger as far as the percent vaccinated, then ending the order. And I understand the mixing of ages, but we can break down the state data based on the ages within that school. So I can understand people's fears that this becomes an unending, continual cycle of masking with no metrics to firmly say, okay, this is when they don't have to mask at athletics anymore. So I think that's my only real issue here, is that we've done this for 2 years now, where we have some sort of date where we revisit a public health order, or we have a trigger where we revisit it. And this one doesn't seem to have that same trigger where we revisit it as a board.
And I'll echo that, Brooke, that I hear from the public and from other folks in the community about, what is the end point. And I guess I don't know that also that staff is prepared to make a recommendation on that this evening. It might be something that we could revisit, at our next meeting around, as we're learning more also about vaccinated breakthrough cases or lack thereof and the risks associated. Because I'm just thinking about what happens if, one school within the district reaches an 85% threshold or whatever is determined to be a threshold that really helps mitigate transmission significantly, but another school within the district doesn't. How is that handled? So
yeah, I think it would have to be countywide. So it would have to be based on, okay, now our 15 to 19-year-old population has hit a 75% vaccination rate. So it wouldn't trigger school by school or district by district, but by the county.
One of the things, in January, if you told me we would have 75% vaccination, I think we would all jump for joy and say, wow, that's going to end this, right? But it was before Delta. And, we've heard with other communicable diseases, infectious diseases like measles or chickenpox, that, when we dropped below 90%, we were in fear of losing herd immunity. And so 75 is not 90, and Delta is as transmissible now as chickenpox. So, I get the frustration, right? But it's going to take probably, I would envision at least 2 months of schools masking or not masking for us to really see what those impacts are, right? On a per 100,000 basis, a per something basis. It's just not going to be next month. And so while I don't have a problem with, putting some kind of date in there. We've extended public health orders before. We've revised public health orders before. We are going to probably learn some things that we just aren't thinking about right now. So, I don't think we can put in a magic number from a percent vaccinated standpoint.
I agree. This is Landry Fagan. I think we should just pick a date to revisit because this is an evolving pandemic. It continues to evolve. The parameters continue to evolve. We couldn't have done what we're doing now, going back to school, without having an online option last year. So I think we need to pass this and agree to revisit it at some interval and look at the data.
Yeah, I agree if there's a revisit date in there. I also have a question though. So this is not a binding health order though, correct? Like the school board can still overrule this health order. Is that correct? Or is that not correct?
No, this is a binding health order. Public health has both the authority and the duty to control the causes of communicable diseases, and the statute that governs Boulder County Public Health specifically calls out schools.
Got it. Okay.
Greg, if I can, I wanted to add something to the discussion that I forgot to mention, and Deirdre reminded me that the changing variants are a critical piece in us making this decision. Both Lexi and Indira alluded to this, and Taylor alluded to this. We didn't know the Delta virus was so contagious, and we didn't know the potential side effects of long-term effects of the Delta variants. And I can't remember which slide it was. The new Lambda variant, I think it was Lexi's slide, are very concerning. And so I think we can't determine exactly the impact of the Delta and Lambda and future variants until we monitor the data, we monitor the cases, we monitor the outbreaks, hospitalizations, and death, all the data you talked about. I think it's very appropriate to have a day to relook at it, but more importantly, it would be to say that this is indeterminate is appropriate. Hopefully we can get this under control with more vaccinations. And I can't tell you what that number is. I do know that number for measles is 95% vaccination. And I don't know where that is for COVID-19 with the multiple variants. I just wanted to add that, Greg. Hopefully that helps the board members.
Thank you.
And, I also want to thank all the members of the public who participated and chimed in this evening. It's, it's really helpful to hear from you. And I hear a lot of strong emotion in all of those public comments. And as a mother of 3 children who are currently ineligible for vaccination, I feel strongly about this too. So I hear all the folks chiming in, and I appreciate everyone taking the time to do so. So thank you for making the time to do it.
Yeah, I mean, I agree, but I think pretty much all of us can universally agree that the ultimate goal is definitely to keep school in person. That is what has to happen. And, up until the guidance has always been, if you're not vaccinated, you should be wearing a mask. And so, if we're talking about a large and an ineligible for vaccination population, the guidance has always been, you have to wear a mask until you can be vaccinated. And, I understand the personal freedom arguments. I get it. But we have a lot of public safety laws, as someone alluded to in the public comments, that keep you from endangering others. Drunk driving, those types of laws. And I can also understand the developmental concerns that a couple people raised during open comments. They want their young children to be able to fully develop verbal skills by looking at their teacher's mouth and looking at the other students. But however, if we go back to remote learning, then it doesn't matter, because now you have all the issues with remote learning again. So really my only concern is that the open-endedness of the order as far as a timeline. So it would be nice if we could pick a date that we would revisit the order if we don't want to put a threshold on it.
May I make a recommendation based on what this board has done historically? Our prior mask order actually was written the same way, in effect until rescinded, modified, or amended by the executive director. And Director Zayak at the time agreed with the board to come back at certain intervals to discuss it, but the order itself remained in effect to allow that flexibility.
So should we agree to revisit it in 2 months? Like, we can talk about it in September, but then revisit the order in October?
Yeah, I would be good with that, especially if we have the vaxxed versus unvaxxed data available at that time.
I mean, the reality is we're going to pay attention to this every month. I mean, we're going to continue to get the updates. Staff knows that we're going to be, really kind of looking at these data specifically. So, and if we see something or you see something that warrants a change, I am very confident you will, recommend those changes. Can I ask a question? How easy or complex is it to prove a medical or religious exemption?
I don't think and can you clarify, is there a religious exemption for wearing a mask, or no, right?
No, there is no religious exemption for wearing a mask. That is probably a reference to Title VII, which applies to employers and vaccines, which is not on the table at this moment. There is the medical exemption, and that would go under an ADA process, but really Boulder County Public Health would not be involved in either counseling or identifying medical exemptions. That would be up to the school districts. Last year, the school districts all put in place processes for parents to apply for a medical exemption on behalf of their children. And that is a system that I believe is already in place.
Could I just make a point of clarification in response to Board Member Harrison's concerns about needing to go back to remote learning? I want to be clear with you all that my understanding from the school districts is that hybrid learning is no longer an option, that is part of their agreement with the teachers unions, that they will not have a hybrid option this year. And so if we have a situation where we have spread because masks have been removed, then those children will be missing a significant amount of school at a mass scale because there is no hybrid option this year. And just to point out that these kinds of changes, I think it's a great idea to revisit the data regularly. And at the same time, this is steering a ship. And these changes to the schools are very disruptive to change protocols, policies, expectations in the middle of a semester. And one of the things that they have emphasized to us at every turn is that they need to know what to expect and not have, rapid changes in what the policies are. And public health can't respond to rapid changes. This is very late in the game. We have been working with the state since the beginning of the summer to try to get school guidance out, and it's taken a long time. And so this is very much kind of ship steering. And I just wanted to make that point. Thank you.
Just reflecting on some of the comments from earlier, when we look at this whole COVID pandemic, right, and we look at the cycles, and we've been up, we've been down. Usually, you can explain why we've been up, right? Summertime last year, people, July 4th, we're starting to feel good. The case numbers were going down. Late July, early August, another peak, right? Especially in the southern states where, indoor time is probably greater than it is, in the cooler months. And then we had the big peak, and then things went down really low Labor Day, and then they just rocketed up all the way to December, and then it fell again. We saw another spike after spring break, and then now we're seeing Delta is predominantly in control, right? And yet we have anywhere from 40 to 80% of populations vaccinated, depending on where you live. And it's still not enough. The case rates are, what we're seeing is that a little increase again. Now, hopefully that's muted and we see that start to tail off in a few weeks like we did last summer. But now we got fall and we got more time indoors and we have less transmission control going on. So it's just a lot of factors that are really kind of, we're in a race against Delta or whatever comes after Delta. And I just, it's unfortunate. But you look at, the school public health modeling that was mentioned earlier. I mean, a 10% decrease in transmission control, which includes masks and social distancing. I mean, that could put us back near last December peak, and that's not good. And I don't want to be there. And for that reason, I will be supporting this public health order.
Yeah, and I'll weigh in and say, I think the number one goal for all of us is to keep kids in school, for mental health reasons, for learning loss reasons, for socialization, and also that, although thankfully at this point kids are less negatively impacted with health outcomes, that's not true of kids with high risk health situations, cardiac conditions, asthma, developmental disabilities, and we need to think about those most vulnerable in our schools. So I also will be supporting this for those reasons.
Any other discussion from the board before we ask for a motion? Okay. Will somebody make a motion?
This is Landry. I make a motion to approve Public Health Order 2021-07 requiring facial coverings indoors for all individuals age 2 and older in child care camps and pre-K through 12 school settings.
This is Morgan, I second.
Okay, we have a motion and a second. All in favor? Aye.
Aye.
Okay, that's 5. So it looks like that motion's unanimous. Okay, thank you very much to all the staff, to all the people who made public comment. Yeah, this is just unfortunately a really difficult situation. You know, we've just got to trust that we're doing the right thing here. All right. Back to the agenda, which will likely go really quickly. Director's report. I didn't really have a chance to review the director's report, Camille. I'm not sure about other board members.
Certainly, Greg, if I may, just very quickly, I know everyone has put in a lot of time and support this evening to this very important subject. I would like to acknowledge Vice President de Santiago and say that, you know, your service is just so appreciated, and next month we will be formally recognizing you. But really officially of sorts, this is your last meeting, I believe. So I just want to acknowledge and thank you so much. I'm sure the sentiments are widespread for our gratitude to you for your lengthy service to this board. I understand. I know I'm very new in my relationship to you, and I'm sad to see you go already, but thank you so much. Anything else, Greg, that you'd like to add, or applause from the Board of Health? Of course, I see some claps from staff as well. Anything else you'd like to add, Greg?
Yeah, I would just like to say, Jorge and I started close to the same time on the board. You know, and I just really appreciate the work that he does and the voice that he brought to the Board of Health. You know, just such a strong, you know, family man, well connected in the community, supporting, you know, underprivileged communities. It just really is, you know, I'm glad that you are, you 2 terms, but, you know, we're going to miss you, Jorge, and we're going to do our best to really continue to have a community champion as a voice on the board.
Thank you, Jorge. We'll miss you and your perspective and your voice. Thanks for your service.
And as we formally look to recognize you next month, we'll invite you back. You know, we always would have a presentation for you, so we hope you have time to come back.
Thank you very much. Appreciate it. It was a pleasure and an honor to be served on the board. Thank you.
Well, I know that was brief. It's such an important thing, but to get on with it, please take a look if you can at the director's report. Our staff put so much work into this, as you know. A couple of very quick highlights. You already know we are seeing a rise in cases. When we were starting to move as an organization to a more of a COVID response, and so we're adjusting a little bit and we're assessing what we will do next relative to staffing needs to support the community, to support our schools as we move forward. It's complex, right? So it isn't as easy as just to say, you know, we're going to keep moving towards recovery. We have to assess our staffing levels, and we will keep you updated about that. There is a bit in your director's report about opioid settlement dollars. So a subject not related to COVID necessarily. Please take a look at that. We are exploring our options as a health department, as well as with our county partners. Those opioid dollars from settlements will be dispersed, and there might be opportunities for us to collaborate. And I see a question from Morgan.
Oh yeah, this was, sorry, unrelated to what you were just talking about, Camille, but just also in the director's report that's called out around the air quality. You know, again, this has been ongoing concern. And so I just want to thank the team from public health who's working at the state. I think this is something we really need to, when we have capacity and energy, to talk about something other than COVID. I mean, this is a huge issue for all of our ongoing health and safety and the health of our kids, as we've spent most of the evening talking about the health of our kids. Like, having our kids outside running around during the summer on these days is just, it's awful. So something else hopefully we can talk about, and I just want to encourage the team that's working at the state level. Thanks.
Thank you. Dr. Nolan, did I miss anything that you wished I would have highlighted out of that report? I know our board is probably tired and our staff too.
I think it's been a long night. I did want to emphasize how much Camille and I and the rest of the leadership team appreciate the enormous amount of work that the staff did to really try to come up with a public health order that met so many different constituents' needs in our community, and put so many hours into it and put so much thoughtfulness into it, and just how much Camille and I appreciate that.
Well said, Dr. Nolan. Thank you. I agree.
Hey, Lexi and Camille, one suggestion for next month during the COVID-19 update. I would be curious to know what your thoughts are in terms of if this current wave doesn't subside, or you know, it gets much worse. What does that mean in terms of, we know that a lot of public health staff were redeployed for 16 months or so on the COVID response, and they've been taking this summer to kind of rest and recharge and get ready to get back into their regular work. And then the ongoing kind of support team that's being built to continue to address the pandemic. I'm just curious, like, what's the risk that people are going to be like pulled back in? And so, I mean, I know we can't really answer that until we see what happens with the case numbers, but you know, just kind of, I'd be curious more of your thoughts about how much we can handle before such a scenario would occur.
We probably have those conversations on a daily basis in directors team and management team. And we would be happy to share some of our strategies with you and our predictions of sorts relative to the long term on this pandemic, the response, the recovery, and all that you mentioned. We'd be happy to do that.
Appreciate that. Thank you.
Yes.
Okay, well, that we have old and new business. Any board members want to announce anything? Okay, then I will announce we are adjourned at 8:32 p.m.
Thanks, everyone.